Master Plan as amended, the 1985 Boyd's Master Plan as amended, the 1994 Clarksburg Master Plan as amended, and the 2009 Germantown Employment Area Sector Plan as amended. When adopted, the Germantown Plan for the Town Sector Zone also amends the General Plan on wedges and corridors. The SMA application covers approximately 1,270 acres under the Town Sector Zone in the Germantown Plan area, all of which land and water is proposed for a change in zoning classification. A Fed committee work session will be scheduled at a later date, and persons wishing to submit additional material for the council's consideration should do so before the close of business on July 30th. Each individual will have 2 minutes to speak, although we have no speakers for this hearing, so this hearing is now closed. Item 7 is a public hearing and action on a special appropriation to the county government's FY22 operating budget for the Department of Health and Human Services COVID-19 response in the amount of $2,665,260 for the Maryland Department of Housing and Community Development Neighborhood Revitalization for the Emergency Housing Program. Action is scheduled immediately following this hearing. We have no speakers for this hearing. The public hearing is now closed. Is there a motion to approve the special appropriation?
So move.
Councilmember Katz moves. Councilmember Rice seconds. All those in favor, please raise your hand. Anybody on the phone? Okay, Councilmember, that is unanimous among those present. Thank you. Item 8 is a public hearing and action on a special appropriation to the county government's FY22 operating budget, COVID-19 Human Services and Community Assistance non-departmental account in the amount of $2,946,776 por nuestra salud y bienestar, for our health and well-being. Action is scheduled immediately following this hearing. We have no speakers. The public hearing is now closed. Is there a motion to approve this special appropriation?
So moved.
Council Vice President moves. Councilmember Rice seconds. All those in favor, please raise your hand. Ms. McMillan, sorry, did you have?
Yes.
I just wanted to note that there is a staff recommended amendment that would, even though this is being introduced and approved using ARPA funds, that would allow other grant funds to be used in place of those if they can be used appropriately. And so it would be necessary for you to move it as amended.
Yes. Council Vice President, is that fine with you? And Councilmember Rice?
Yes.
Great. Okay. All those in favor of the bill with the staff amendment, please raise your hand.
Aye.
Special appropriation. That is unanimous among those present. Great. Thank you. Thank you, Ms. McMillan. Very helpful. Item 9 is a public hearing and action on a special appropriation to the county government's FY22 operating budget, COVID-19 Human Services and Community Assistance non-departmental account in the amount of $1,701,809 for African American Health Program COVID Response and Resolution to amend the county government's FY22 operating budget resolution 19872, Section G, designation of entities for non-competitive contract award status, the National Center for Children and Families, Inc. Action is scheduled immediately following this hearing. We have no speakers, so the public hearing is now closed. Is there a motion to approve this special appropriation?
So moved.
Councilmember Rice moves. Councilmember Katz seconds. All those in favor, please raise your hand. That is unanimous among those present. Thank you. Item 10 is a public hearing and action on a special appropriation to the county government's FY22 operating budget for the Department of Health and Human Service in the amount of $1,150,000 for Asian American Health Initiative COVID response. Action is scheduled immediately following this hearing. We have 4 speakers for this hearing. Ms. Kennedy, can you please call on the first speaker?
Yes, good afternoon. Our first speaker today is Nguyen. You have 2 minutes for your testimony, and you may begin when you're ready.
Good afternoon. Yeah, on behalf of the Asian American Steering Committee and the Asian American communities, I would like to thank the Council Vice President Alpanos, Council President Hucker, and the councils for your support and for hosting the hearing today. We're going to the special appropriation of our FY22 support for the Asian American COVID response. And first and foremost, and that is my biggest thanks for your looking into the need of our community. While we county make great progress in terms of the vaccination for COVID, the rise of the Delta variants and other potential variants really cause our concern. So more than ever, the need for effort to increase education, engagement with our community, and to address the impact of direct and indirect impact of COVID to the community, from housing, social services, and mental health to the various constituent youth, the business owner and seniors, etc., is critical. So the initial, I just want to share quick, the initial funding and commitment from the county allow us to start planning for this effort. Therefore, the continuous funding is critical. And thank you for acting on this so urgently and allow us the opportunity to continue to build on your effort. You will hear more from my colleague who representing different Asian American communities shortly. Just want to conclude by thank you again for your support, and I'm looking forward to the continual partnership between our communities, the council, and the Department of Health and Human Services. Thank you, the council member and all the staff for making this happen.
Thank you, Doctor.
Thank you for your testimony. Our next speaker for this public hearing is Hoisin Liu. You have 2 minutes for your testimony, and you may begin when you're ready.
Hi, hi everyone. Thank you for giving me this opportunity to give this testimony. I was planning to sitting in the office and have a nice and quiet environment, but I was just get an emergency call from my kids' school, telling me to pick up my child because they have a COVID case on the bus. So it's live and it's currently what's happening. So it gives me the feeling that we all feels like the COVID, it's going away and it's leaving us, but it's actually still happening around us. So that goes to my pleas for the council's support for continue doing the COVID service. It's not away yet. It's not leaving us yet. So, in summary, in KCCC, we provide COVID testing and COVID vaccine. We're fighting at the front line to trying to fight COVID. And we are actually also ready to move forward to the post-COVID service. So we are planning to provide healthcare and health-related service, for example, mental health and other service that is very we identified it's an important need in our community. But I mean, with what's happening today, I surely would think that we still would need to stay the front line and fight the COVID until we all feel rest assured that it's going away. So that's all the point I want to make. And also the community clinics, the community organization, we also need the funding support and the staff support and also all the resource support to help us to continue helping the community.
Thank you for your testimony. Our next speaker for this public hearing is Ji-Young Cho. You also have 2 minutes for your testimony, and you may begin when you're ready.
Okay, thank you. Good afternoon, Council President and Council members. My name is Ji-Young Cho, Executive Director of Korean Community Service Center. On behalf of KCCC's board and staff, I would like to express great appreciation for your support of the Asian American community of Montgomery County. The health and mental health of our community continues to be at great risk, and the KCCC believes that special appropriation is critically needed to enhance the Asian American Health Initiative's COVID-19 response. Because of significant cultural barriers and economic and social vulnerabilities and limited English proficiency, our clients have been deeply impacted by the pandemic, enduring high levels of isolation, depression, and fear with related health and social consequences. Most recently, we are witnessing increasing anxieties because of the rising infection rate due to the Delta variant. In addition to the health consequences, there has been a severe economic impact for our community. Many Asian small businesses have had to close permanently or at least downsize staff and reduce work hours. Ongoing school closures and limited summer activities have had an emotional toll on kids and parents alike. Fortunately, KCCC was able to provide emergency rental assistance and grocery coupon support through our safety net program. Through the Sharing Love campaign, KCCC raised over $350,000 directly from community members and ethnic churches. Still, we anticipate there will be ongoing needs in the coming month. While KCCC has also been working hard to persuade our community members to get vaccinated, we are aware that some vaccine hesitancy persists. We are currently working closely with the community leaders and other influencers to spread the word about the importance of getting the vaccine, but much more work is still needed. To ensure a healthy and emotionally secure community, we needed the continuing support of Montgomery County Council. We sincerely appreciate your deep commitment to our community. Thanks so much.
Thank you for your testimony. Mr. Hucker, that wraps up the speakers for this public hearing.
Thank you so much, Ms. Kennedy. Thank you to all our speakers. This public hearing is now closed. Is there a motion to approve the special Oh, I'm sorry, Council Vice President Albornoz.
Sure. Just really quickly, I'd like to make a comment and then we'll move the motion. But I do want to thank Dr. Nguyen, all the members of our Asian American Health Initiative who remain steadfast and dedicated in their commitment to building bridges in our community, both the direct service that they provide and the manner in which they go about ensuring that everyone in our community has access to health care has been particularly important this last year and a half. And I hope they know, and I know I speak on behalf of all of my colleagues, that this investment in them, as well as our Latino Health Initiative and African American Health Program, is just further evidence of our commitment to you and our deep appreciation for your work. With that, I'd like to move this special appropriation.
Council Vice President moves and Councilmember Rice seconds. All those in favor of the special appropriation, please raise your hand.
Aye.
That is unanimous among those present. Thank you. Item 10.5 is now the introduction in action on a resolution to amend FY22 Operating Budget Resolution 19872, Section G, Fiscal Year 2022, Designation of Entities for Non-Competitive Contract Award Status, Primary Care Coalition for Asian, I'm sorry.
Yes, this is the non-competitive award for the Asian American Health Initiative.
Sorry. Two in a row. Action is scheduled immediately following this hearing. Ms. Kennedy, are there any speakers for this hearing? Ms. Kennedy?
There is no hearing necessary for this introduction and action, Mr. President.
Wonderful. Okay, thank you. Is there a motion to approve this special appropriation?
So moved.
Councilmember Katz moves. Councilmember Albornoz seconds. All those in favor, please raise your hand. Councilmember Reamer, are you with us?
Aye. Sorry.
No worries. Okay, great. All those unanimous among all those present. Thank you. The special appropriation is approved. Thank you, Ms. McMillan. Terrific. Item 11 is a public hearing and action on a special appropriation to the county government's FY22 operating budget for the Department of Health and Human Services in the amount of $2,903,172 for the Department of Recreation in the amount of $300,000 for the Community Engagement Cluster in the amount of $330,000 and for Montgomery County Public Schools in the amount of $1,585,633 for newcomers, enhancements, and assistance. Action is scheduled immediately following this hearing. We have no speakers for this hearing, so the public hearing is now closed. Ms. Martin, did you have a comment, or Ms. McMillan? Okay.
There are committee amendments to this appropriation. I don't know if HHS Chair Albornoz wishes to discuss them, or if you'd like me to review them.
Mr.
Sure.
Chair.
There are two amendments that we discussed in committee. One to make full-time the positions that would go to our street outreach network as opposed to contractors, and that was approximately $300,000, I believe, or thereabouts. And then the second was to also provide support for our Department of Recreation. As we know, the prevention-based services that they provide in this space are critical, and they have been important players all the way through. So this adds an additional resource to complete the model that we know works and is so critically important to these families.
And so just to clarify, the amendment that would add 4 positions to the street outreach network as well as 2 vans would add $280,013 to the special appropriation that the executive sent over. The shift from a contract position to a merit position in the Department of Recreation does not add any additional dollars. It just moves the dollars from operating to personnel costs. But if the motion is moved as amended by, if the committee, the committee motion, which is what's on the table, is approved, those two changes would be made.
Okay.
I'd like to move as amended the motion.
The chairman moves the amendment, and Council Member Rice seconds. Terrific. All those in favor of the special appropriation as amended, please raise your hand.
Aye.
That is unanimous among those present. Thanks, Ms. McMillan. Item 12 is a public hearing and action on a special appropriation of the county government's FY22 operating budget for the Department of Health and Human Services in the amount of $816,067 for Community Services Block Grant, CARES. Action is scheduled immediately following this hearing. There are no speakers for this hearing, so the public hearing is now closed. Is there a motion to approve this special appropriation?
So moved.
Councilmember Rice moves. Councilmember Katz seconds. All those in favor, please raise your hand.
Aye.
That is unanimous among those present. Thank you. Okay, and item 13 is a public hearing action on a special appropriation to the county government's FY22 operating budget for the Department of Health and Human Services in the amount of $970,360 for FY22 American Rescue Plan funding increase for Head Start programs. Action is scheduled immediately following this hearing. We have no speakers for this hearing, so the public hearing is now closed. Is there a motion to approve this special appropriation? The chairman moves, and the Councilmember Katz seconds. All those in favor, please raise your hand.
Aye.
Unanimous among those present. Thank you. That special appropriation is approved as well. Item 14 will be a presentation from the Office of Legislative Oversight on the impact of the COVID-19 pandemic on women. Ms. Latham?
Yes. Good afternoon.
Yes. Councilmember Jawando.
Yeah, if I could just briefly, just 30 seconds. I appreciate it. Just wanted to thank you again for scheduling this briefing. It'll be short on the time on this schedule, but it's important, I think, to note that we're doing it on the last day of session before a few weeks where we're not in session, still working, obviously. And we'll be hosting similar, a little over a year ago now, almost. We hosted my office in conjunction with a range of women's groups and other community groups, a town hall on the impact COVID was having disproportionately on women. And out of that, we had a great conversation. But out of that, I had also asked the Office of Legislative Oversight to do this very thorough report that has many, many issues that we won't be able to cover and go in depth today. But I look forward to working with each of my colleagues to address a lot of these issues. And we'll be coming back and having a public conversation, another town hall on this report in the fall. So just wanted to notify folks about that as well, and really appreciate the great work OLO has done on this project. Thank you, Mr. President.
Thank you. Ms. Latham?
Okay. Actually, Caitlin is going to start off our presentation. This is, I think, her first presentation to council. So,
Ms. Simmons, welcome. Thank you.
Hi, no problem. All right. Let me get this in presentation mode. All right. Good afternoon. My name is Caitlin Simmons, and this is Kristen Latham. We're from the Office of Legislative Oversight, and we're here to present to you our report on the impact of the COVID-19 pandemic on women. And before we begin, we would just like to thank the many county staff and nonprofits that spoke with us during the course of this report. So this report responds to the council's request to summarize the impact of COVID-19 on women in 5 areas. I will discuss workplace equity and employment, childcare, and economic insecurity, and Kristen will then discuss healthcare and domestic violence, followed by our recommendations for action. This brief presentation provides a very high-level summary of our findings, so for more details on any of these areas, please see the full report. It's also important to note that OLO applied an intersectional lens to the research of each area, which recognizes that individuals can experience multiple and intersecting forms of systemic inequalities across gender, race, age, class, sexual orientation, immigrant status, and disability status within these areas. And before we get into those topic areas, OLO has 2 overall conclusions. Women, especially women of color and immigrant women, have borne the brunt of the pandemic and experienced greater impact to their economic security and health. And COVID has also exposed and magnified pre-existing inequities across social, political, and economic systems. So first, I will discuss the impacts of COVID on workplace equity. Prior to the pandemic, women had faced inequity in the workplace, such as being overrepresented in front-facing industries and earning less compared to their male peers. There are two significant reasons for this job loss. The recession caused by the pandemic targeted industries where women were overrepresented, such as retail, leisure, and hospitality, and education and health services. These industries suffered significant job losses, and women experienced an outsized share of those job losses, as is represented in this chart. The second reason is that women are more likely to leave the workforce or reduce work hours for caregiving responsibilities. Women reported a significant increase in caregiving responsibilities as schools closed, in addition to taking on care for elderly family members. And these reasons have contributed to the decrease of women in the labor force. The chart shows national trends, and as you can see, a significant amount of women have left the labor force due to the pandemic. Between January and December 2020, nearly 2.1 million women left the labor force. And as of May 2021, the labor force participation rate has not recovered to pre-pandemic levels. Employment data by gender is not available at the county level yet, but the available data has followed these national trends. Labor force participation decreased and unemployment increased significantly after March 2020 and is still not back to pre-pandemic levels in the county. Women of color and immigrant populations have experienced more job and wage loss compared to white women. Of the 2.1 million job losses mentioned in the previous slide, 42% were for Black and Latina women. The bar graph on the slide shows the national unemployment rates of women by race, and as you can see, Black and Latina women and Asian individuals have experienced higher rates of unemployment compared to white women throughout the pandemic. One primary reason for this is that women of color and immigrant populations are overrepresented in service industries that rely on face-to-face interactions, which are the industries that have had greater job loss. Overall, stakeholders anticipate some long-term impacts on women's unemployment. The already present gender and racial inequities in the workforce will be magnified as working adults who leave the workforce, either voluntarily or involuntarily, during a recession tend to have persistently lower earnings compared to their peers who kept their jobs. The next section I'll talk about is how COVID has impacted the childcare industry, as childcare is an integral part of a woman's ability to work. So prior to the pandemic, childcare was unaffordable for many families as there were not enough slots for all children in the county. The pandemic exacerbated these issues and caused new ones, such as increasing operating costs to comply with CDC guidelines and lowering capacity. The number of clients enrolled in childcare across the county has decreased while the operating costs have increased. The pandemic has also caused significant staffing challenges for many childcare providers, which is an equity issue as childcare staff are predominantly older women of color. Stakeholders report that providers in low-income areas are more likely to be struggling financially and in more risk of closing down compared to providers in high-income areas. Unfortunately, limited data exists at the county level on the current local childcare industry. There's not data on the number of childcare slots available during the pandemic. However, based on national data and stakeholder feedback, there is concern about the long-term sustainability of childcare providers, and it can be assumed that there will be permanent losses of childcare slots in the county. And now, briefly, I will talk about economic insecurity, as COVID-related job and wage loss has contributed to widespread economic insecurity. So the pandemic, especially early on, caused widespread economic insecurity, and studies conducted found that in April 2020, about 1/3 of Americans reported that they would not be able to pay some of their bills. About 18 million adults report their household did not have enough to eat in the early stages of the pandemic, and 11 million households in 2020 reported falling behind on housing payments. For all these categories, people of color were more likely to experience these insecurities. For the county, food insecurity and general economic insecurity has risen in the county. In 2019, there were 89,270 county residents considered insecure, and in 2020, food insecurity rose as 100,000 county residents were considered food insecure. Further, the Office of Eligibility and Support Services provided OLO with data on its biggest 3 support programs, which are represented on the chart on the slide. For each program, the average monthly caseload has increased significantly. Staff also report that while they do not track clients by gender, anecdotally, the majority of applicants to these programs are women. And for all these households, stakeholders anticipate that this need will persist past the expiration of COVID relief funding. And the pandemic has exacerbated housing insecurity nationwide, and many households have fallen behind on rent. In Montgomery County, stakeholders estimate that 13 to 15% of renters are behind on housing payments. Of the 9,137 applications for rental assistance received by the county in 2020, The average amount of rent owed by households were $3,360. However, that was the amount owed at the time of applications, and stakeholders believe that the amount owed by these households has increased since then. One particular concern that was raised is the amount of accumulated debt while trying to stay on top of bills and housing payments, especially when moratoriums end. And stakeholders are worried that this could lead to a significant number of evictions. And now I will turn the presentation over to Kristen.
Thank you, Caitlin. I will now briefly talk about the pandemic's effect on healthcare of women, followed by the impact on domestic violence. First, healthcare. Research states that overall, women were more likely to have foregone health care compared to men during the pandemic. The table on the slide shows the percentage of respondents to a national survey who reported that they skipped various types of medical services during the pandemic. As you can see, women were significantly more likely to skip preventative care or treatment, and were also more likely to not be able to get an appointment. This disparity was worse with women of color, who are more likely than white women to forego health services. As for the county, there is limited and inconsistent data. Some county programs do not track gender, while others keep data on both gender and race, but do not necessarily know the intersection of the two. However, county staff report that while they do not have the data to confirm this, that they are seeing similar trends in the use of county services. Some county programs report that they have maintained their numbers pre-pandemic, like dental services, while some report that women are putting off health services, like the maternity partnership program. The most significant issue facing women, according to all the stakeholders we talked to, was mental health. Most said that women are experiencing the COVID squeeze, the stress and anxiety resulting from no space or alone time, isolation, having to balance work, virtual school, and childcare, elder care, and economic insecurity. A survey highlighted in this slide shows the percentage of respondents who say worry or stress has impacted their lives during the pandemic. As you can see, women, and in particular mothers, were much more likely to experience stress or worry compared to men or fathers. Almost all stakeholders that we spoke with reported that these mental health issues for women will continue long after the pandemic. However, there's concern about the availability of mental health services, particularly that there's not enough affordable mental health services in the county, which prior to the pandemic, which has only been magnified since the pandemic. There's also significant need for culturally competent mental health services that are available in various languages. And now I'll briefly summarize the effect of the pandemic on domestic violence. But before I begin, it is important to note that there is no way to know the full impact of the pandemic on domestic violence, as domestic violence incidents are historically underreported, and many experts fear even more so during the pandemic. While domestic violence incidents have increased by 8% nationally in the initial months after lockdown orders, county staff report that the number of domestic violence incidents in this county did not increase during the pandemic, but the severity of incidents reported did, in particular strangulations. Shown in the slide, Montgomery County Police provided OLO with comparative data on domestic violence incidents for the first 5 months of the past 3 years. As the data show, aggravated assaults, which includes the strangulations, have increased significantly over the past 3 years. Many stakeholders also anticipate an increase in domestic violence when the world opens back up again, as victims will be less reliant on abusers for financial stability and will have easier access to resources and community supports. Stakeholders also identified 2 longer-term impacts of the pandemic on domestic violence. First, the victims of domestic violence have been seeking out significantly more mental health and counseling services than prior to the pandemic, and that need will only continue. Second, the closure of the courts has had a significant impact on domestic violence victims. While the courts were still hearing protective order cases, the stoppage and delay in other cases has resulted in considerable anxiety and fear within victims. Trials of perpetrators were delayed, and survivors had not been able to address divorce and/or custody issues, making it much more difficult to leave an abusive situation. These issues will continue for the foreseeable future, as the courts have a significant backlog caused by the pandemic. And now I will briefly talk about our recommendations for council action. As this presentation has shown, that the COVID pandemic will have social and economic impacts for years. It has exposed vulnerabilities in social, political, and economic systems and deepened pre-existing gender and racial inequities. The increased demand for these social service supports will not end when the pandemic ends. Therefore, we have 3 recommendations for council action to help support women throughout the county. Our first recommendation is about data collection. OLO found that there is limited data, county data, on the demographics of clients accessing county programs. Many staff could only anecdotally refer to the gender or race of the clients they serve. OLO recommends that the county departments collect data on clients accessing county programs by gender, race, and location in order to better help determine which residents and areas of the county require aid and resources. Our second recommendation is that the council ask the executive to assess the need for mental health programs and supports, particularly the availability of more affordable and culturally competent programs and services. Finally, as we stated, the pandemic has magnified existing systemic inequality for women, but particularly for women of color and women in immigrant communities. To solve these inequities, it is important to take a holistic, intersectional, and long-term approach to discuss and implement policy. OLO recommends that the council conduct comprehensive discussions with stakeholders in order to determine how to address these issues facing women of the county. Some of these issues could include quality and affordable health care, affordable daycare, increased support for domestic violence victims, housing insecurity, transportation inequity, and workplace equity and flexibility. That is our report. We'd like to thank you for your time and thank again all the stakeholders that we spoke to throughout this report. And I will turn it back to the council president.
That's terrific. Thank you so much to both of you for this very, very helpful presentation. Colleagues, any questions? Council Vice President Albornoz.
Thank you. Not a question. I know we're going to get into this later. I want to thank Councilmember Jawando for initiating this request and for the town hall he held several months ago. And I look forward to participating in the one he will be holding in the future, because there's no question that this is an economic issue. It's a moral issue, and one that we are going to have to address holistically across all 6 committees, because there is no one simple solution to this. It has to be among our highest priorities. I'm confident this council will continue to make it among our highest priorities. And the data is critical, but what we were even able to ascertain is already extraordinarily alarming. So I look forward to this ongoing discussion and a more comprehensive discussion after we get back together again in September. But thank you again, Councilmember Jawando, and thank you, OLO, for initiating this, once again, terrific report.
Absolutely. Anyone else? Okay. Thank you so much. We have a lot of work ahead. This is very, very helpful to us. See you soon. Item 15 is a presentation that the council will receive from each of, whoops.
Freezing.
I'm freezing? Okay.
No, you're not. I think it's Councilmember Jawando's.
The council will now receive a presentation from each of the 8 2021 Summer Fellows. This is the 5th year the County Council has hosted a Summer Fellows program for graduate students between their first and second year of study in a policy degree. The program is designed for the students to gain real-world experience across multiple fields and has enabled participants to work directly with decision makers on ongoing projects, policy analyses, and self-selected research projects. Today's presentations highlight the self-directed research project of the Fellows. I will turn it over to Ms. Rodriguez and Ms. Dunn. Welcome.
Good afternoon, council members. As Council President Hucker noted in his introduction, we have 8 amazing graduate student fellows here today to present a summary of their independent research paper thus far. They joined us on June 7th and have placements throughout county government, including the council's central staff, the Office of Innovation, MC-DOT, the Office of Racial Equity and Social Justice, and TEBS. They've had the opportunity to visit key sites throughout the county, meet with experts and leaders in the field, and with many of you, in addition to their day-to-day work in their placement. Their program concludes on August 13th. The topics you will hear about today vary from lessons learned during the COVID-19 pandemic, in addition to economic development, parks, racial equity, and more. So as I mentioned, we have 8 fellows with us today, and to ensure the council has the opportunity to ask questions, we would like the first 4 to go straight through their presentations, and then we can turn it over to the council president and the council for around 7 minutes of questions and answer period. And then we will go to the next 4 in a block and then open it up again to questions and answers, if that's okay with the council president and the council.
Mr. President.
That sounds great. Thank you, Councilmember Rice.
Just very quickly, just a point of order. Ms. Rodriguez Hernandez, you know a little bit about this Summer Fellows program, don't you?
Yes, I do. I was a summer fellow in 2017 in the inaugural cohort, and thankfully Councilmember Rice liked my presentation that these fellows are doing now, and liked me enough to have me join him in his office as I finished graduate school, and that was an amazing opportunity. I hope many of them get this opportunity as well.
There you go.
So again, we will send their final reports to you at the conclusion of the program, and we will also send their presentations this week as well to all of you. We will start with our first block of 4, beginning with Eva Acevedo.
Hi, everyone. I'm just going to start sharing my screen. Can everyone see my presentation? Great. All right, good afternoon, everyone. And especially good afternoon to council members. Thank you for the opportunity to present our research. My name is Eva Acevedo. I am a second-year Master of Public Policy student at the University of Maryland, and I've been working with the Council Central staff this summer. My research project is on guaranteed basic income and develops a framework for what a guaranteed income pilot could look like in Montgomery County. Researching in recent years, guaranteed income has gained momentum as a tool to combat poverty, income inequality, racial disparity gaps, and potentially work displacement brought about by automation and artificial intelligence. So what exactly is guaranteed income as opposed to universal basic income? They do function very similarly. UBI is a direct recurring cash payment to all members of the community, regardless of income level or employment status or some other means test. In contrast, guaranteed income provides cash payments to a targeted group of people with a particular goal, such as addressing economic insecurity among that group or in an attempt to bridge racial disparity gaps. Although a bold policy, the idea of an income guarantee is not new. Why is the time to act now? The rise in income and wealth inequality since the 1970s and stagnating wages, especially for low-wage jobs, has resulted in many Americans living in precarious economic situations. Prior to COVID-19, 40% of Americans could not afford a $400 emergency, and the pandemic further exposed the economic fragility of many American households. Currently, the number of guaranteed income pilots across the U.S. is rising. This trend started before the pandemic, and since then has increased, with even more local jurisdictions announcing pilot programs. A guaranteed income pilot in Montgomery County would be an opportunity to uplift a group of people from right here in our county and to experiment and be innovative and propel guaranteed income forward nationally. To develop a framework for a Montgomery County pilot, I looked at past pilot programs focusing on these 3 on the screen. These 3 pilots chose low-income residents as their target population. The Stockton and Ontario pilots were run by local government, and both were designed as randomized controlled trials. The program in Jackson, Mississippi was run by a nonprofit organization. Participants across the 3 pilots had positive outcomes in the following areas. I will highlight a few. They experienced increased financial stability, which meant less income volatility, bills being paid on time consistently, less borrowing, and less income pooling. They also saw major improvements to food security, reductions in anxiety and depression. Some decided to return to school or upgrade their skills, and rates of full-time employment increased. Taken together, these results dismantle the belief that low-income individuals would misuse cash payments if given with no strings attached. From the pilots, I identified key features which I recommend the council consider if building a guaranteed income pilot in the county. And these are to extensively promote the pilot to generate interest and inform would-be eligible participants. Where possible, design some aspects with direct community feedback or with specific community needs in mind to enhance benefits to participants and build trust. Take steps to mitigate benefit cliffs, which occur when an increase in income, such as from guaranteed income, results in reduction or a loss in other public benefits. This can be done by pursuing waivers, incorporating individualized benefit counseling for the participants, and you can even establish a reimbursement fund. In terms of the program evaluation design, both database and anecdotal evidence are crucial. Currently, there's a need for more rigorously designed guaranteed income experiments to be conducted, which is something to keep in mind when choosing an evaluation partner. Also, you should plan to collect long-term participant outcomes, as those are currently missing from the research. In looking at the target populations of other pilots, I have come up with 2 policy options for a potential pilot in Montgomery County. The first is to randomly select a group of residents from households at or below 50% of the county's median household income. The focus of this target group is to measure the impact of guaranteed income on the most economically disadvantaged households. The second option is to randomly select individuals from a cohort of an existing program aimed at helping low-income individuals become self-sufficient. For example, this could be participants in the Public Assistance to Entrepreneurship program or in a job training component of temporary cash assistance. The focus of this group is to support these individuals as they exit these programs with new skills and training, and to measure the ability of guaranteed income to further uplift them towards achieving self-sufficiency. Thank you for listening. I look forward to sending you my final report.
Thank you, Eva. We will now move to Isabelle Chestnut.
Hi, can everyone see my screen?
Yes.
Hello, council members, staff, and residents of Montgomery County. My name is Isabelle Chestnut. I'm a second-year Master of Public Policy student at the University of Maryland, and I have been working in the Office of Racial Equity and Social Justice this summer. I have chosen to do my research project on racial equity and vaccine distribution in the county. With a population of 1.1 residents, Montgomery County seems to have done its due diligence in providing vaccine information and resources to all residents. However, broken down demographically, communities of color have the lowest pre-registration rates and continue to have the lowest vaccine rates compared to their white counterparts. As part of my research, I will analyze 2 questions. Were there disparities in vaccine distribution for communities of color? And what can Montgomery County do to close those disparities as it relates to COVID-19 and other illnesses? In this graph, we will see side-by-side data on Montgomery County's population and pre-registration demographics. During the pre-registration phase, in March 2021, out of all the residents who received at least 1 dose of either the Pfizer or Moderna vaccine, white residents had the highest registration rates, with 51%, while making up 43% of the population, compared to communities of color whose rates were significantly lower. In the framework of equitable access to COVID vaccination report, the county did identify disparities for communities of color during the pre-registration phase. Those disparities included language and literacy issues, meaning that some vaccine information had not been translated properly, mobility constraints, such as transportation, to locations for vaccines, such as mass vac sites, or the first come, first served appointment process, which could have been difficult for residents who did not have the opportunity to monitor when doses were made available or easy access to computers. The pre-registration phase was created with the idea of providing equitable vaccine distribution to all communities in Montgomery County. However, for communities of color, vaccine access had led to the lowest pre-registration number. Since March 2021, after seeing such low pre-registration numbers, the county has established a network to increase vaccine distribution and confidence for communities of color. The Department of Health and Human Services has established 3 minority health programs that use the community engagement model to conduct outreach on how to achieve equitable rollout for vaccines and other illnesses affecting communities of color. These programs include the African American Health Program, the Latino Health Initiative, and the Asian American Health Initiative. Each program and initiative meets residents where they are at in the community to conduct surveys, focus groups, and to hear what residents are saying as it pertains to their health and the resources they are being provided. Which is why I was conducting my research thoroughly, and as a way to build upon the work the county has already done, my recommendation is the development of racial equity toolkit specifically for COVID-19. This toolkit will be different from the previously mentioned framework for equitable access to the COVID-19 vaccination. It will serve as a guide for the county and departments to use when making decisions for pandemic relief for communities of color. With the rise of COVID cases and unvaccinated people in the country, as well as the new threat of the Delta variant, This toolkit will provide county departments with a list of questions to ensure racial equity is included in the decision-making process. I've identified 3 other local jurisdictions, such as Madison, Wisconsin, Seattle, and Portland, Oregon, that also have a racial equity toolkit for COVID-19. The success of other jurisdiction toolkit has been from the creation of goals that it focuses on. Collectively, these goals are identifying populations and urgent needs, the establishment of expectations for development of equity goals and performance measures, and providing easy access to tools and technical assistance that can help inform priorities, strategies, decision-making. I have included an example questions for Montgomery County to use in their toolkit. The first is to describe the policy, initiative, program, or budget issue you will be evaluating. The second is, are there ways this COVID-19 response or lack of response could potentially harm specific policies, specific populations, or communities? How can we mitigate those unintended consequences? Why is your issue area and the decision you will make significant to communities of color? And why is it necessary that you, as a representative of the county, evaluate this decision using a racial equity analysis? I would like to thank the council for listening to my presentation, and I look forward to sharing my final report. Thank you.
Thank you, Isis. Next, we have Madison Holland.
Thank you, Nicole. I'm just going to go ahead and share my screen real quick. Can everyone see this? Are we looking at the presentation or my?
Yes, on editing mode. Yes, we can. Now it's full presentation. Thank you.
Okay, great. Thank you. Great job to my colleagues. Thank you, council members. I'm Madison Holland, and I am a second-year Master of Public Policy student at the University of Maryland. In the summer, I've been working in the Office of Broadband Programs, focusing on our digital equity efforts. So this is just my own individual analysis and not reflective of our TEBS or OBP. So what is digital equity? When we think of digital equity, it is a state in which all families, regardless of income, has access to broadband devices, the services, and the skills that they need to connect to the online world. And now during the COVID pandemic, we've seen that our economy, our democracy, and even our education has now been online. OBP focuses on achieving digital equity through 3 main pillars of digital equity. The first, broadband connection. So do we have an initial internet connection in our homes? The second, connected devices. Do we have a laptop or a tablet to connect to the internet? The third, digital literacy. Do you have skills to use that laptop and tablet and fully participate in the online world? We do this through several programs: MoCoNet, Emergency Broadband Benefit, Emergency Connectivity Fund, and Senior Plan at Montgomery. For the presentation, I'll be focusing on our EBB and ECF funds. So what's our problem in Montgomery County? We have about 80,000 low-income homes in Montgomery County. Of those low-income homes, 36% do not have broadband access. So they don't have that first pillar of digital equity. 27% do not have a computer in their homes, so they don't have the second pillar of a connected device. And we can actually see the compounded disparity of not having a broadband connection or a computer in this digital equity map, as you can see kind of in the center area of Montgomery County, especially in District 3. These red areas really are just have heavily disparages, especially given the COVID-19 pandemic really sent us all online almost overnight. As you can think that these families probably had no access to their lives now online. So what did we do about this? We use a lot of our federal funds. So the first is the Emergency Broadband Benefit Program provided by ARPA funding, and this is a $50 monthly discount off of our internet connection. It's of minimal cost to Montgomery County. So Montgomery County does not pay for any substantive cost of having that internet discount, but we pay for the administrative cost for OBP to execute this in the office. Our enrollment so far is at 4,000 registrants. 4,000 low-income homes have signed up for this, and our goal in OBP is to get 10,000 families registered. Council members, the reason this plateau is because of a lack of staff. So we need more people to go out into the community, bilingual contractors, people who can really reach people where they are and make them know more about this service. The other federal fund is the Emergency Connectivity Program. Again, this is a minimal cost to Montgomery County. OBP plans to distribute 10,000 Google Chromebooks, and we really want to target those who maybe didn't get that Google Chromebook from the Montgomery County public school system. So lower income parents, older adults, homeschool kids, and this launches in October. Again, this would be a little bit more effective if we had additional staff to fully execute this program. These two programs are really important because it really affects both of our, or two of our main pillars of digital equity. First, broadband connection, and the second, connected devices. So how do we fully utilize these federal programs now so that we can really start the race into digital equity in the future? We need to increase our resources, such as staffing, to administer our federal fund. And what would this look like? For the Emergency Broadband Benefit Program, it's extended federally until 2026. Again, it's a very minimal cost to Montgomery County, but we invested in resources now, given additional staffing experts, communication strategists, field organizers. Additional staff and resources would maximize our effectiveness, and we would really reach well beyond our goal of 10,000 families and get people that initial connection in their homes. For our Emergency Connectivity Fund, there are federal funds for devices purchased in fiscal year 2022. Again, it's a very minimal cost in Montgomery County, and if we invested now, then we could really have this program for the long run and achieve more digital equity in the future. So although the Emergency Connectivity Fund ends federally, it continues statewide because the Maryland General Assembly just funded about $30 million for devices. A financial staffer or someone who is more skilled in grant experts could really help with that smooth transition in the program and continue the ECF program for Montgomery County. So additional staffing and resources would really maximize our effectiveness and provide more people more connected devices throughout the county. Montgomery County is in a really great policy time right now because we have two federal funds that are minimizing our costs to Montgomery County and are expanding our digital equity efforts. So we really need to take advantage of this opportunity right now, and we can potentially lead the state in digital equity efforts and offer those 28,000 families access to today's connected world. Thank you.
Great, thank you, Madison. And our final presentation of the first block of 4 is Jamie Penaritas.
Thank you, Nicole. Okay, can we see the whole screen?
Yes.
Excellent. So good afternoon, council and staff. Thank you for taking the time to hear from us today. My name is Jamie Penaritas, and I am a second-year Master of Public Administration student at the University of Georgia. This summer, I've been working with the Department of Technology and Enterprise Business Solution, or TEBS, in the Office of Change Management. Today, I will be discussing ways to enable technology innovations after COVID-19, considering lessons learned and what we can do going forward. So the past year and a half have definitely been challenging across the board. In particular, the coronavirus pandemic has exposed areas where we have needed technology innovations for a long time, while simultaneously providing an opportunity to develop those solutions. It is important to note in March 2020, I know it was a long time ago for all of us, there were only 18 days between the announcement of the first COVID cases in the state, which did happen to be in Montgomery County, and the complete closure of all non-essential businesses by order of the governor. So this quick timeline really demonstrates the immediate nature of the shift to remote work, which then necessitated quick solutions to close those gaps. So key questions I wanted to consider in this report include what services NOCO began to provide to residents during COVID-19, why those services may not have been previously available, even though we could have used them at the time, and how Montgomery County can work to enable technology innovations in the future. So I do want to take a moment to highlight some examples of successful COVID-related technology innovations: the MC311 chatbot, the HHS vaccination hotline virtual agent, and seamless docs. In my final report, I will go into more depth about each example, but for the sake of time, I won't talk about each one individually today. Instead, I just want to highlight some of the key takeaways, which I think are: 1, the impacts of these solutions, some of which I've highlighted on the right-hand column, and 2, the lessons that we've learned. So in the past, implementing technology solutions such as these would have taken much longer. For example, seamless docs was granted an emergency exception to the ordinary procurement model, where it normally would take 6 months to a year to get a program and fully implement it into the workflow. Now, we can't be granting exceptions left and right all the time, but it does raise the question of how can we normalize the deployment of new technologies so that they're already available when they're needed and we don't have any delays of service. So taking into consideration these questions, I arrived at my problem statement, which is solutions are mostly developed in response to crisis. Now, this is true of many organizations and not just Montgomery County government, but I think that suggests an even broader issue that Montgomery County government is certainly capable of tackling. So why is it that our strategy for innovation tends to be reactive instead of proactive? And what can we do to fix that? So in my efforts to explore these questions, I conducted interviews with several staff members in TEBS. Potential contributing factors to our reactive approach include a siloed approach to technology by department, the absence of a regular review process to assess technologies after implementation, and that employees don't often have opportunities to collaborate with people outside of their immediate work group. After speaking with several staff members, I began to look into best practices to address the key issues that I've identified, which I've listed again on the slide and will inform my recommendation. So here we go. So given the comments I've heard from staff, as well as the best practices of internal communications, my recommendation is to establish a two-way feedback channel between TEBS and other departments within the enterprise. This is something that TEBS has already begun to explore in a limited capacity. For example, there's an ongoing needs assessment for applications in an effort to explore the needs before developing those solutions. So my recommendation would follow a similar structure, but would expand the scope to include other technology beyond application. And in particular, the formation of standing work groups to this end will encourage collaboration within TEBS as well as across departments as it relates to technology deployment, which would fill a gap in current operations. Montgomery County government's reactive approach to technology innovations does hurt residents by slowing response in times of crisis, whereas if we were constantly innovating through a proactive strategy, we would already be prepared and wouldn't have to delay resident services due to internal adjustments. This proposal can serve as an important step towards adopting a proactive strategy of technology innovation. Finally, I want to close off this presentation by emphasizing how important this issue is across Montgomery County government as a whole. Technology affects the entire county, including resident services as well as internal operations. Take Seamless, for example, which is bought by TEBS and provided for the whole organization. It can be used for onboarding, permitting, licenses, and more. This improves function across the board. So other examples of COVID-era technology innovations that I haven't discussed in this presentation include the use of Microsoft Teams, virtual meetings, town halls, the meetings that we're in right now. In an increasingly digital world, it is important that Montgomery County government stays up to date in its technology use, and this means that the county needs a way to discover technology needs on a regular basis before a crisis occurs. Thank you for listening.
Thank you, Jamie. Yes, that is our first block of 4, and I'll turn it to you, Council President Hucker, for any questions.
Thank you so much to all of you. That was really enlightening. Colleagues, any questions for the first 4? Councilmember Rice.
Thank you very much, and impressive job by all of you. It's just very interesting. As I was texting with one of my colleagues, we certainly could have used a few of your presentations with our earlier discussion around 5G, that's for sure, especially that chart that was striking about where some of the needs are, where folks don't have access to broadband or devices. So great job there, Madison. Let me just ask each of you, based on what's changed, because our data keeps changing every single day in terms of access, right? So we've actually now made some better strides than we had been. Like we just saw numbers just this morning that are brand new. So for Eva, when it comes to the accessibility for folks with vaccinations, and we've actually seen that now we've got a rise in our Latinx population to where they're actually getting vaccinated at better rates. And so data is always as good as what it was right this morning, right? Because it's always ever changing. But I'm just curious as to whether or not you saw that some of the things we were doing would lead us to that. So like we were on the right track and just we needed to double down on our efforts, or if you saw it as more of that we needed to change the dynamic of what it was that we were doing and go in a different direction to achieve even greater success.
I think that question was for me.
Oh, I'm sorry. So it's for you. I'm sorry. I apologize.
Yeah, that was totally fine. So when I was doing my research, I found that some of the data from the pulse reports that started in January, like the pre-registration numbers for communities of color, went down. So I do believe that the county did exactly what it needed to do in providing equitable vaccines for communities. I just feel that the county needs to double down, like you said, on more resources and toolkits as we continue to go through the pandemic, since it seems like there is a rise in cases and the Delta variant, that is a new threat for people who are currently vaccinated. The county should just continue to work on what they already have. And with this toolkit that I suggested, they should be able to do that when it comes to like departments making decisions. Thank you for the question.
No, thank you. That's very, very helpful. And then, Eva, I'm sorry because I messed yours up and mixed it up with Dice's because I have a question for you also. So when it comes to SNAP benefits, right, which are now being heavily debated at the federal level in terms of reauthorization, where do you see that in the mix when it comes to GBI versus UBI in terms of which do you see that are focused? Because we have a nationwide push right now through the National Association of Counties in pushing for SNAP benefits, right? And so and it's like full court press. I mean, this is like very current. So it's perfect that you're talking about this and analyzing this. What do you see as the best bang for our buck when it comes to where it is that we should focus our efforts, understanding obviously that all of the things in the toolkit that we can throw at it are still not going to be enough, but where should we be focusing and leveraging our resources, understanding that those are things that seem to be helping when it comes to folks really trying to make ends meet and get themselves to a higher level that's a standardization, right? Not something that goes up and down, but it would be something that's, you know, there for them. So what's your thought there with SNAP reauthorization?
In looking at the guaranteed income pilots and their results, across the board in all of the programs that I looked at, food security was the biggest area where participants saw improvements. So most of the money from the guaranteed income was spent on food, and they were able to, a lot of them expressed that they had enough money finally to allocate all of the money that they could to food and cover all of their food expenses. So I do agree that I think that SNAP benefits are extremely consequential and important for families, as food security is a big issue. And just in terms of how those two would interact, some programs were successful in achieving waivers for certain programs so that the participants wouldn't lose benefits in those areas, but it depends widely on location.
Thank you very much for that. And just lastly, between Madison and Jamie, let me just say amen. There's not much more I can say. You guys know that I've spent a lot of time in this effort over the past little bit over a year, focusing on broadband and technology for the nation as a whole as we try and move forward. So thank you for highlighting some of those really important points and ways in which we can continue to move innovation as well as accessibility and affordability for residents throughout. So thank you very much for all of your presentations. Thank you, Mr. President.
Thank you. Councilmember Glass.
Thank you very much, Mr. President. All of these presentations were on the nose, as Councilmember Rice was alluding to. So I don't know if I should give kudos to Council President Hucker for coordinating all of this happening today, but certainly to the fellows for having the foresight at the beginning of this program to see what the needs of the community really are. And you have pinpointed them beautifully, at least in this first half of the presentations. And for me, you really have captured two policy areas that I care about, equity and efficiency and innovation, quite frankly. And I don't have a whole lot of questions, but I'll just make a comment or two. And for Lysis, we talk so much here in Montgomery County about King County as a leading indicator or as a peer county, and you captured that in Seattle. But thank you for sharing with us that Madison, Wisconsin, and Portland, Oregon have similar policies. So now I can look towards those jurisdictions and see what they're working on as well, because again, King County and Montgomery County share policy goals. So thank you for enlightening me on that. The technology, I would love to have a follow-up in a few years, right? As this is a moving and ever changing landscape. And as Councilmember Rice so passionately said in our previous conversation, right, we know that we need to bring more equity into our technological aspects of life, into our infrastructure. And I'm hopeful that we can do that. But we need a plan, and I think what was presented is a thoughtful plan to help do that. And so again, thank you for that. And then lastly, I'll just say to Eva, the income is a really interesting topic, and you know we all see what Andrew Yang has proposed, and I appreciate him bringing it to the forefront during the last year or so. But there are smaller things also that have been taking place, even here in Montgomery County, and I look forward to reading your report. But one thing also to note is that when COVID started, or even right before COVID, we started here in Montgomery County providing direct cash assistance to individuals who are experiencing homelessness. And so whether or not that would be considered guaranteed income or a basic income, it was direct cash to individuals who needed it. And so look forward to seeing more thoughts that you have about how we can do this. I don't know if it was on your radar. You're nodding. Were you aware of that policy?
I was not actually.
Well, there you go. Well, I'm happy to follow up
Something
with you.
to add.
There you go. And so feel free to reach out, and I can provide you with some more details and put you in touch with the Services to End and Prevent Homelessness, who can give you more on that. But thank you all. I look forward to reading the reports, and good job with these presentations and the timeliness of these presentations.
Thank you. Councilmember Katz.
Thank you very much, Mr. President, and congratulations to all. They were most interesting, and look forward to hear the next four. And I know we're under a time frame, but I'd like to ask Madison, please, about the digital divide. Where did you get the information on the digital divide itself? How did you get that information?
On the digital divide, such as like digital disparities or specific counties?
No, when you showed the map, and I think you mentioned District 3 specifically, which obviously caused me to look up right away. Where did you get that information from?
So that's data that's collected from the census, and the Office of Broadband Programs has gathered it in a GIS map. I can send you that map if you'd like.
Well, and I'd appreciate that. You know, Gaithersburg, the city of Gaithersburg was actually the first franchise that was cable TV in Montgomery County to have cable, and the rest of Montgomery County came afterwards. Gaithersburg is the only area that is not under the cable franchises from the county. And I was wondering whether or not any of that information, whether it had anything to do with any of this for the digital divide.
I am not sure. I can put that in my report and give it to you. And also, just to clarify, it's from the U.S. Census data in 2019.
Okay, I appreciate that, and thank you for all, every one of the fellows for all your hard work. Most appreciated. Thank you, Mr. President. I'll turn it back to you.
Thank you, Council Vice President Albornoz.
Thanks. I'll be quick. Just a few observations. First of all, great job, everyone. And as all of my colleagues have noted, the timing of our presentations could not be more important. And my observation is all four of them are inextricably linked. Basic income and guaranteed basic income will lead to better health outcomes. There's no question about that. And addressing digital divide issues also has direct implications for overall public health. And within the technology innovations, I know that obviously in the telehealth and telemedicine space, we've made tremendous strides, but it's predicated on addressing the digital divide issues. And then, of course, the analysis around our BIPOC health initiatives was critically important, and also just underscores how government alone can't do this, that we have to have really strong community engaged partners at all levels in order for us to be able to expand our safety net and address the needs of communities in a real and authentic way. So just wanted to make those observations and express my deep appreciation to all four of you for these presentations, and I look forward to the other four as well.
Terrific. Anyone else? Thank you. Oh, Councilmember Jawanda.
Thank you. Just also wanted to say congrats. I enjoyed meeting with all of you recently, and really excited about these projects and to follow up with you and to read the full reports. On the vaccine equity, we made so many efforts here in the county, and had some kind of late breaking news when we were trying to, allow younger African American Latino residents to get the vaccine earlier, right? And then the governor took the authority away the night before. It was kind of a dramatic fashion. But we have our great BIPOC health initiatives, and we just authorized the Asian one today, that are doing great work and are going to continue to do great work to get great results in our community. We were already using zip code analysis, so just really timely. The guaranteed income, critical, more to come on that. Just really a digital divide. All of this, we hope this, as the infrastructure bill hangs in the balance here, and all the things that we need to do to expand current capacity and go even further. So just really kudos to all of you. You did a great job, and we're going to be, you're going to be probably getting a lot of follow up. So it's good. It's a good thing when you hear from us. So thank you.
Thank you. Okay, Nicole, I think back to you.
Yes, thank you. Thank you, council members, for all of your questions and comments for our first group of summer fellows. And we have an continued exciting second group. And I'm happy that they're here to share their presentations as well. And we'll start off with David Paul.
All right. Good afternoon, council members. My name is David Paul. I'm a public policy student at Georgetown University. It's tough to follow up my peer fellows, but I'm going to do my best. I'll be talking to you about the Homeless Persons Docket. The Homeless Persons Docket, or HPD for short, was approved in the last budget. Council approved $100,000 to implement it, with the goal of diverting people facing homelessness from the criminal justice system and into supportive services. It's based off the 2019 Interagency Commission on Homelessness recommendations. The county's made strong progress on homelessness over the years, but there's still many people who are still quite vulnerable, living unsheltered or with severe mental illness, and they are the ones most vulnerable to policies that criminalize homelessness. Things like sleeping in public or urinating in public, which are unavoidable when you're homeless, can lead to criminal records that are barriers to housing and to public services and employment. And so to address this, there's been many homeless courts that have sprung up around the country, but there still aren't very many of them, and the evidence on them is still fairly limited. My report has been focused on how the HPD can look to other homeless courts, mental health courts, and drug courts to gain evidence and to make sure that it can innovate and evaluate its success in its first few years. My hope is that this presentation can help council consider how to support the HPD. This is the HPD process. I won't talk through every step of it. The main points are that someone would receive a referral from law enforcement or from a service provider. They would meet with the public defender and the assistant state attorney during a docket session, and then they would be assigned to different service providers over a 90-day period. If they engage with those service providers and come to monthly docket sessions to report on their progress, then the state would dismiss their charges, making them eligible for expungement. In the long term, graduates would not have those criminal records and ideally stay engaged with services that can help them achieve their goals and self-sufficiency. And so looking at that process, I divided my research into 5 different areas, so best practice areas. Overall, I find that the HPD is well aligned to the practices of its peers and well positioned to succeed. I can't talk through all the findings from the report, but I'm going to give you an overview of each of these sections and focus on 3 recommendations that would involve action from council in addition to the people most involved with implementing the report. So for the services and legal process, the HPD is designed to keep the referral process and the expungement process efficient and recognize the needs of people who are facing homelessness. I think a great thing to do would be after 6 months of its operations, the HPD could host an inaugural graduation ceremony to celebrate the progress of participants who've been through the program and also to raise awareness around the program's success. I think that after the HPD has been in operation for a few years, council could consider piloting the HART referral system that the ICH recommended in its report. This is important because the HPD can do post-booking diversion, so once someone's already committed an offense, whereas the HART system would allow service providers, law enforcement, and community members to make referrals before someone commits an offense. This will make it so that we have a comprehensive system in the county to get people plugged into services and legal aid when they need it most. For the participant experience, the HPD is going to be unintimidating and accessible for people facing homelessness. Progress Place in Silver Spring is a great place to host the docket, although in the long term, implementers might consider a second or rotating location to make sure it's still accessible to people who don't live near Silver Spring. For stakeholder collaboration, the HPD is really well positioned here. Peer programs emphasized having a central point person, and the HPD will have that in the program coordinator, as well as having well-defined roles for all the different program partners. As far as monitoring and evaluation, I think that the HPD could become a national model and leader because it's going to be collecting good data from day one and tracking participants' long-term outcomes. One concrete way to improve that would be to have an exit questionnaire so that participants can give direct feedback on the process and make sure that we're centering the perspectives of people facing homelessness in a program that's meant to benefit them. In the long term, I think that council should request a report that integrates the HPD's evaluation with the evaluation of the mental health court, the drug court, as well as some of the reimagining public safety efforts. The point of this is for council to have a comprehensive understanding of all the divergent efforts within the county and to get a better understanding of how law enforcement interacts with some of the most vulnerable members of our community. I think this can also show how the HPD can help address some longstanding racial inequities and other disparities within the justice system. Finally, as far as the funding and sustainability of the program, one thing that came up a lot with peer programs is a lack of dedicated resources. Many of them rely on voluntary private legal assistance or rely on grant opportunities and grant funding. Council's already allocated specific funding for the program, and I think it should continue to do that, especially as the program identifies its scope and number of participants and after its first year. So my hope is that all of these insights and the success of the HPD can encourage council to continue to take action at the state level and the local level to decriminalize homelessness. The other ICH recommendations can be a great starting place to consider those different actions. And overall, I hope that the county can begin to better treat our neighbors experiencing homelessness and align that with our county's core values. Thanks so much, and looking forward to your questions.
Thank you, David. Next, we have Jonathan Robison.
Jonathan, I think
Jonathan, you're muted.
Sorry about that. There we go. Can you hear me now? No. Can you hear me now? Sorry.
We can hear you, Jonathan.
My apologies. So my name is Jonathan Robison, and I am a urban planning student with a focus on transportation at Cornell University. And this summer, I am with MCDOT. Today, I will be talking with you about transit to trails. So first, let's define what transit to trails is. Transit to trails is about ensuring that everyone, no matter who they are or where they live, has equitable access to parks and green spaces. And this is something that's become more acute as the pandemic hit. It's also important to note that while trails is in the name, it's meant to be more comprehensive. So it's not just about trails. If you don't like hiking, it's about all green spaces and recreational spaces. So the first part of this analysis was looking at the geographic dispersion of parks across the county. So you can see here that unsurprisingly, in the denser part of the county, there are a lot of small neighborhood parks, but the largest parks with the most space and the most amenities are in Up County and West County over here. Highlighted in red are the 5 most popular county-owned parks in the system, the first being Rock Creek Regional Park, followed by Wheaton, Black Hill, Little Bennett, and the South Germantown Recreational Park. Second was determining, so where do people who lack cars live within the county? And using Census Bureau data determined that it's concentrated mostly in Down County, unsurprisingly around the Red Line metro stations, but not exclusively. We do have this outlier here in Gaithersburg and also along the Route 29 corridor. And it's important to note that in some places, nearly 38% of homes do not have access to a vehicle, and that there's also significant overlap with the county's equity emphasis areas, which are highlighted in blue. Third was examining, so how does the location of parks compare to where carless people are? In pink, you can see areas where 1 in 10 houses lack access to a vehicle. And again, they're mostly down county, so they're closer to small urban parks and some linear parks, but they're still quite far away from the larger green spaces in up county, including 3 of the 5 of the most popular parks in the county system. So you could say, okay, those people can take the bus, right? So the next stop is determining where the ride-on system goes and what stops people can access parks from. So this map is an analysis of all the stops, about 4,800 stops in the ride-on system that have access to a park. And you can see that about 500 or so have access to a park entrance or trailhead. And there's much greater access down in down county, but up in up county, it's much harder. Many of the larger parks, there is access, but for many of the parks, there's absolutely no accessibility unless you own a vehicle. So how do we rectify this problem? For that, I did some research and also turned to some real world examples. You can see 4 here, and more details will be available in my final paper. And they led to 5 policy proposals of escalating level of complexity, difficulty, and cost, kind of answering this main how can't we question. And of course, we need to be cognizant that there are budgetary and regulatory issues at work. It would, in some cases, require significant intergovernmental and interagency cooperation, and there are existing infrastructure problems and promotional needs that come into play with all of these. The first and the simplest are design changes to improve the legibility of the information on the ride-on system. And that is whether in the maps or schedules, and you can see displayed here. There's not really much here to tell anybody that they are near a park or riding past a park. And so design changes like adding shading here or here, where our major parks, for instance, the 31 circumnavigates Wheaton Regional Park, the second most popular park in the system over here, or Seneca Creek State Park, or even adding just a simple tree symbol along some of these routes next to a stop to let the rider know, hey, this is where you should get off if you want to access a park. Next is a wayfinding map feature online, similar to the New Jersey Transit one. And this would build off an existing county resource, the MC Atlas, and would allow users to find a park, click on it, and tell them which bus or which rail line to get on to access the park. Third is service headways and days. So for buses that do access parks, many of them don't actually run that frequently, though. For instance, this is an example of the 31. It runs only during peak hours, and it doesn't run on the weekends, which are the most popular time to visit a park. So this is something to examine about, which routes should we be expanding and improving the access and days of operation that will allow people to access parks through the existing system. The fourth is service alterations, and this would be small changes to existing routes that would improve direct access to parks and park amenities. So that would allow for riders to be dropped off directly within a park, removing any last mile barriers. And this is an example for Wheaton Regional Park. In red, you can see the existing routing of the bus system, and in purple, some small proposed changes that would allow riders to directly access Brookside Gardens, for instance, or the athletic complex down here. Finally, is thinking about creating dedicated seasonal weekend service to the most popular destinations like Great Falls, Black Hill, or Seneca Creek, none of which have existing transit service or capable transit service. And here's one proposal of a route to Great Falls. This is similar to what Seattle and the King County Metro are doing, and would improve not only equity of access, but also could potentially lower car congestion and parking demand. So that was my analysis and some of my policy recommendations. Thank you all for listening, and to everyone who supported this project.
Thank you so much, Jonathan. And our last two, starting with Rachel Schaefer.
Thanks so much, Nicole. And as I'm queuing this up, I just want to echo the sentiments of everyone and just say well done to all my fellow cohort members. And thank you so much, Council, for having us here today. My name is Rachel Schaefer. I'm a Master of Public Policy student at the University of Michigan, and I was placed at the Office of Innovation this summer. So I'll be speaking today about what behavioral science is, how it's being used in the public sector, and how Montgomery County can further apply behavioral science insights to improve programs, policies, and outreach efforts. To get us started understanding what behavioral science is and how it's used, I'm going to ask a quick question. So just reflect to yourself for a moment which message you think leads to a reduction in household energy use. I'll give us just a couple moments to reflect, so don't overthink it. Just go with your instinct and write down your answer. Our options are A, you can save money by reducing your electricity use. B, do your part to help our environment, reduce your electricity use. C, leave a better world for our children and grandchildren, reduce your electricity use for future generations. Or D, You use more energy than your neighbors. Join your neighbors in reducing your electricity use. So just take a second, conclude for yourself what you think it is, lock your answer in. Go ahead and write it down if you have a means to. And we will see that the answer in this case is actually D. And this might be surprising to some since we can see the merits of each option. And as this example shows, how we think people will behave in response to messaging and policies, etc., doesn't always align with the behaviors that we see in actuality, and that's where behavioral science can come in. In the case of energy use, studies using behavioral insights have shown that employing social norms by including peer comparisons in energy reports, such as the example seen on the right here, is effective in reducing household energy consumption. An important connected point to all this is that we don't know what works best until we're able to test it. So all of this matters because, as we know, the success of public service efforts depend on how residents and government workers behave in response to those efforts. Using behavioral insights helps ensure programs, policies, and outreach have a greater impact by using an evidence-based understanding of what motivates behaviors and decision-making. So governments at all levels have caught on to this and have increasingly been using behavioral insights to improve outcomes across a variety of policy domains. To call out just one example, the behavioral insights team in partnership with a county level police force in the UK found that by making a small change in communications materials, significantly increased the number of Black and minority ethnic applicants scoring well on a key test component of their assessment process. By priming candidates in their invitation email for the test to reflect on what they could positively contribute to the force and how that might impact their community, Black and minority ethnic candidates' performance on the test significantly improved relative to those who did not receive these reflective prompts, as you can see on the graph here. This example demonstrates that small, cost-free applications of behavioral insights in a process can lead to improved policy outcomes, such as increased diversity in hiring. So Montgomery County has actually already begun finding ways to apply behavioral insights. One example is a partnership between Montgomery County Recreation and the Office of Innovation, which made it easier for residents to apply for Rec Assist dollars by making it harder to make common mistakes while filling out the form. So by making small changes in how information is formatted to be completed, the application process is made easier for both residents and government employees, which helps to ensure more residents are able to access available resources through this program. Building on this work, my research this summer focused in part on how the county might conduct impact evaluations by testing to see what works. So working with the vaccine messaging team, we conducted a randomized control trial. A diagram of the process can be seen on the slide here, testing two versions of the vaccine update message against each other to see if we could measure differences in resident engagement. This test demonstrated that we can measure differences in engagement and therefore the impact of each message using a current county outreach tool, GovDelivery. And further testing is needed to determine what messaging elements work best to engage residents. And these learnings can be applied to future outreach efforts to increase impact. So where does this leave us and where do we go from here? As I said, Montgomery County has already demonstrated a commitment to beginning this work by establishing the Office of Innovation and getting these projects going, which is great. That means that we've already got the ball rolling. In order to build on that and heighten those efforts, I would recommend passing legislation to further the use of behavioral science insights to improve our programs, policies, and processes. This can be modeled off an executive order passed under the Obama administration, which includes recommendations like embedding behavioral science experts and increasing capacity for impact evaluation. To get started carrying out some of those goals, I would also recommend increasing capacity to implement behavioral design and conduct evaluations. Currently, there are no designated staff solely dedicated to these efforts, and while I know there are champions within departments who support this work, I believe there's a need for a point person or team of people to lend behavioral science expertise, conduct analyses, and coordinate partnership efforts. And that's all I have for today. Thank you so much for your time, and I look forward to seeing continued innovations in the county.
Thank you so much, Rachel. Great job. And last but not least, we have Andrew Wen.
Awesome. Thanks so much, everyone, and thanks so much, council members, for having us today. My name is Andrew, and I'm a Master of Public Administration student at Cornell University. And today I will be presenting on the lessons learned from our emergency food security programs that we set up during the pandemic. So in the past year, the county and our nonprofit network really came together and tackled the rising food insecurity issues in our communities. With oversight from the newly created Food Security Task Force, the county more than doubled its annual funding for community food assistance. More importantly, though, this money was not spent on just emergency food purchases, but it was also spent on improving the overall quality of services available. There were too many programs and expanded work done by our community food service providers in the past year to fit into a short presentation. So instead, I'm going to focus on two specific initiatives funded by the county, the Food Access Call Center and the Service Consolidation Hubs. I analyzed data from these new services and found that they increased food access, strengthened our referral systems, and improved our ability to make data-informed decisions. These findings show that the county now has an opportunity to build on this momentum and permanently strengthen our food systems. However, to accomplish this, the county would need a strong internal advocate that can elevate food security issues across our departments. In the next few slides, I want to first highlight some of the many benefits of the Food Access Call Center and the Consolidation Hubs. I will then describe how a central organizing body can help extend these benefits into a stronger and more cohesive food assistance network. So the Food Access Call Center was created in June 2020 as a dedicated phone service due to the high number of calls coming into 311 asking for food. To date, over half the number of calls coming into the call center are from Spanish speakers. 40% of callers report that they face mobility challenges, such as a lack of access to transportation, and 70% report income insecurity, such as unemployment. The Food Access Call Center is also unique because they're able to track where food insecure residents live, and thus where the need actually exists. Other data sets either project food insecurity rates through algorithms or rely on data based on the locations of food access providers. The map on the left here shows the distribution of calls coming into the call centers by zip code. And the map on the bottom right is that same map overlaid with our equity focus areas from the planning department, showing that the Food Access Call Center is indeed serving high need areas. The next initiative that I want to highlight are service consolidation hubs. There are now 8 service consolidation hubs across the county, bringing local community partners together to provide services at convenient locations. As you can see on the map on the bottom, the actual locations of the service consolidation hubs are close to the areas receiving a high number of calls from the call center, showing that the county has created programs at locations where food insecure populations live. Yet what makes the hub special isn't just their convenient locations. The hubs have also grown to offer a variety of community services, and they're also providing detailed data reports about these services. 2 of these examples are home delivery services, for homebound residents, as well as case management referrals. As you can see on the 2 graphs on the left, home delivery services on top and case management referrals on the bottom, these services have not seen a decrease in demand in recent months. Over the next year, the hubs have ambitious plans to include even more services, volunteer programming, and community activities. They're really a great example of how the county can work with nonprofit organizations and together create new partnerships that directly serve community needs. So moving forward, how can we sustain this momentum? I believe that the creation of the Food Access Call Center and the Service Consolidation Hubs are made possible because of a centralized food security team within the county. And in the past year, this role was played by the Food Security Task Force. However, this task force was set up during the pandemic as a temporary emergency service team. And without them, much of their work has no clear home in the county. Prior to the pandemic, food contracts are monitored by 6 staff members across the HHS's many service units, including public health and children, youth, and family services. And the Food Access Call Center does not have a dedicated permanent staff. By creating a central permanent organizing body for food insecurity within the county, we can improve coordination of food security issues within the HHS and also across our many other departments such as agriculture or housing. A centralized organizing body can also improve our partnerships with the nonprofit sector, allowing them better access to us as well as leveraging our communication systems and the call center. The Nonprofit Food Council, which primarily organizes the nonprofit sector, does a great job bringing everyone together, but they really have a singular lens of focus, and they may not be able to connect food assistance as effectively with, say, vaccine distributions or other programs that is under the purview of the county. Finally, a centralized food security body can help with data collection. As you've seen from the previous slides, the abundance of data and services at the consolidation hubs and the Food Access Call Center is a great example of what can be done with county oversight. With sustained support and funding, the county can improve data collection within its contractual food providers and create a model for data-informed decision-making for other food assistance providers across the region. Thank you so much for your time.
Thank you, Andrew. And that concludes all 8 Summer Fellow presentations. Thank you, council members, for hanging in there with us. I know it's a lot of information, and I turn it to the council president.
Thank you so much, Nicole. Thanks to all of you for these great presentations. Very inspiring. It reflects a lot of hard work. We have a lot to think about. Councilmember Katz.
Thank you, Mr. President. I've had a moment I couldn't cut on my to speak. Mr. Paul, on the homeless person's docket, in Maryland, is it in Baltimore City? Where do they have homeless persons dockets now?
So the only other one is in Baltimore City within Maryland. There are other problem-solving courts, so drug courts and mental health courts and veterans courts throughout Maryland. But this would be the second one in the state.
And of course, the state has to approve it. We worked on this council worked on mental health courts, and the state, we had to work with the state and many other stakeholders, literally, to come together to do that. So I will certainly follow up. I'm the chair of the Public Safety Committee. We certainly will follow up on the homeless docket. I had heard of it, but I didn't know that much about it. So I will look forward to reading your report, and thank you for doing it. And congratulations to the other fellows as well. Thank you, Mr. President. I'll turn it back to you.
Thank you, Councilmember Glass.
Thank you very much, Mr. President. I appreciate Councilmember Katz asking about the homeless persons docket and the expansion of it here into Montgomery County. And so, David, thank you for laying all that out. I'm excited for that work to get underway here in Montgomery County. And we collectively approved the $100,000 in this last budget, and thank the county executive for including it. And the flip side to that is also the equity part for those who have been committed, non-violent offenses, as you noted, David, and make sure that they can fairly get housing. And so that's why I'm pleased to have introduced with Councilmember Katz the Housing Justice Act, which all of my colleagues unanimously supported, so that we can try and make homelessness rare, brief, and non-recurring on both ends. And so thank you for that, David. Jonathan, I appreciate the buses in the parks, and what you have literally done is provide us a roadmap, because I can remember about a year and a half ago or so, one of the last times we had an in-person meeting here, and we had a presentation, one of our semi-annual presentations from the planning department and the parks department, and I had asked Chair Anderson and Director Riley about getting people who need transit, require transit, are dependent on transit, getting them to parks. And it was something that we all collectively agree is important, but you have laid it out for us. And so thank you for that information. I really do appreciate that. Rachel, I knew the answer to your question, because I listened to one of my podcasts is Hidden Brain, and I've read Freakonomics, and I know the importance of social interaction and peer pressure, quite frankly. And so I think it is a lesson for us to include possibly a little bit more in some of our work. Elected officials and policymakers don't always want to publicly chide people to do the right thing, but sometimes we need all the tools in our disposal. And so thank you for highlighting that. There are other for those of you who are interested in other environmental policies, those two places, the Hidden Brain and Freakonomics, have other insights into how to get people to do the right thing, sometimes unbeknownst to them. So thank you, Rachel. And then Andrew, last but not least, for sure, the policies that you've laid out, I think, are just so important, particularly in this post-pandemic world, that we need to continue innovating and making sure that local government provides all the resources for everybody here, and food most definitely is one, and this council and a number of my colleagues have been leading on that issue most definitely. So thank you for that information, Andrew, and we'll certainly apply that as we do moving forward. But again, tremendous presentations. I do look forward to reading all the final reports from each of you, and congratulations and thank you for helping provide more policy solutions for the residents here in Montgomery County. I yield back, Mr. President.
Thank you, Councilmember Rice.
So I'm just floored by every single one of you. Let me just say, and seriously, I always love summer fellows, but each and every year you guys just continue to step it up. It's just simply amazing. I'm going to start from the last and work my way forward. Andrew, look, food security is huge. It's one of the first things we did as a council in responding to the pandemic. One of the first actions we took was to make sure that we stood up food security. And so spot on. I will also tell you, and Council President Hucker knows this all too well. Unfortunately, Councilmember Navarro isn't with us this afternoon. She had another function to go to. But the Metropolitan Washington Council of Governments is about to take a vote on standing up a brand new standing committee called the Food and Agricultural Regional Member Committee that deals with food insecurity. So, I mean, this is something that's highlighted in this region, in this Metropolitan Washington region, not just here in Montgomery County, not just in the state of Maryland. And so this is a big deal. And so you're spot on in terms of your recommendations about what we need to double down on in terms of what we've done and need to continue to do. I will say what was striking to me was that rise in some of the requests for services that have just recently happened, right? So even as we think we're stabilizing, the calls for requests for service have started to increase into July. So we're seeing another spike similar to a spike we saw before when we also had a spike in cases. That's intriguing. So thank you. Behavioral messaging, Rachel, awesome. I got it wrong. I held up number one because I'm always thinking people are always about the dollars and cents, right? So, but absolutely. And so, but it is interesting because something that Councilmember Glass said that I think is incredibly important is that, you know, we had said at the beginning, right, colleagues, we had talked about this and said, you know, we were going to do messaging and we were going to say how we got vaccinated and how everybody else should. And we kind of let it go, right? We kind of let it go and we didn't do it. Rachel, you inspired me to say, you know what, I'm going to pressure the council that we need to come up with doing this again and coming up with ways in which we can do these videos, because hopefully some of that will help to pressure people and encourage people to do the same kinds of things. I mean, we had talked about being on TikTok and on Instagram and putting stuff out there, and it just didn't happen. But it's something that I think we should do. So anyway, thank you for that, because it ties directly into what we're struggling with right now, with ensuring that we can get those last to be vaccinated people to get them to push over the edge, including all the other things that we care about in this county that we can use that behavioral science to make sure that we're getting folks to do. Jonathan, wow. I actually called out the chair when they last presented about access to trails. And we were talking about mountain biking, and that's why I have an invitation in my inbox now to go mountain biking with the chair. But I said, look, the reality is that we can build all this great stuff and spend lots of money, but if folks don't have access to it, then what does it matter? And that's what you've highlighted. You highlighted the fact that especially in areas in the Up County, and the reality is this, is though, even though some of them have cars, right, they've only got one. And they've got one car for a family that may consist of 6 to 8 people. And so even then, one person may be using the car for work, and it still means that if the other person who's at home wants to take the children and go to a park or something like that, then they have to use mass transit. And mass transit in the Up County, as you saw when you highlighted the routes, those routes take 45 minutes, an hour, just in the Up County to get places. My daughter can't even ride the bus where we live in Darnestown. There's no bus stop that's actually safe. She'd have to walk down a road that doesn't even have a median or a sidewalk. I mean, or not even a sidewalk, but like a shoulder to walk on. I mean, so it's like, it's incredibly and inherently dangerous. So you couldn't even get a ride-on bus from where we live. And so those are the kinds of things that, again, are spelled out. I love it. It's point on. And then, David, you've already heard from my colleagues who deal, and, you know, we have our lead for homelessness. Incredibly important, the work that we're doing in trying to decriminalize homelessness and make sure that we can get people on a pathway of support and lifting them up and getting them the help and resources that they need. So again, kudos to every single one of you. You guys are impressive, seriously. And I'm not just saying that because I could have kept my mouth shut. and just been like, yeah, Mr. President, and Tom would have been happy because we would have moved things along. But let me just say again, seriously, great work. Absolutely impressive. All things that matter to us tremendously right now, that are current, that are going to make a difference. So thank you very much for all that you guys have done.
Thank you so much. Councilmember Friedson.
Well, thank you. Just echoing colleagues, the previous group and this group, the entire cohort, just astounding. The quality of your work. I really look forward to going into more detail. The topics are just so timely and so important, are so related to so much of the work that we have been doing and so much of the issues that we are currently dealing with. So thank you for that. I look forward to many future Nicoles in terms of those of you who would be willing to come back to the council and share with us more of your talent and your hard work. We certainly could use it here. So keep that in mind. Don't forget about us little people when you go off and do all the great things that you do. I will say a couple things. I wish I could comment on everybody's projects, but Jonathan, as the parks lead on the council, the trails issue is something of particular importance to me. And I think it's such an important topic that you have raised, as you heard about from other colleagues. We have been in this conversation about turning rails to trails and trails back to rail, and that has really dominated the American conversation about this. But trails are transportation infrastructure, and access to the amenities are critical, and connectivity to those transit-oriented recreation, transit-oriented amenities are so important to health and well-being and quality of life. So thank you for that. I will point out to Councilmember Rice, I have been subjected to that same invitation by the planning board chair, and there's some embarrassing pictures of me going mountain biking, so careful what you wish for there. But I just wanted to thank you all for the exceptional work. This is a really great program. We certainly have huge benefits. The county has benefited from this as well. There's a number of policies that we put in place directly as a result of work of your predecessors, and I know that we'll be diving deeply into all of the work that you've done here, and we'll be figuring out ways that we can operationalize your work here as well. So thank you so much. Keep up the great work. Look forward to diving in more, and I think you should all expect to hear from several of us as we look to put into practice some of the research and efforts that you've done here. So thank you.
Terrific. Okay, I don't see any other requests to speak. So thanks to all of you for giving us so much to think about over the next few weeks and beyond. So very much appreciate all your hard work and stay in close touch. Thanks so much, Nicole and Pam, as well. Okay, next is item 16. It's action on confirmation of the county executive's appointment of the Regional Service Center directors, Luisa Cardona, Pete Fosselman, Jacob Newman, and Greg Wims.
I'd like to move approval if we need that.
Sounds good. Is there a second?
Second.
Councilmember Friedson seconds. All those in favor of the 4 appointments, please raise your hand. That is unanimous among those present. Okay, congratulations to all 4 of you. Thank you. Next, we can have legislative session day 20. We just have one introduction. It's expedited bill 3321, personnel employees retirement system group E amendments. Lead sponsors the council president at the request of the county executive. Mr. Drummer, do you have a comment on this? Are we good? I think you're muted.
I can explain the bill even when I'm not muted.
Sure.
The bill is sent over by the executive. It comes out of a collective bargaining agreement, and it would move approximately 30 resident supervisors who work in the Department of Corrections from one defined benefit retirement plan to another. The difference being that it would allow them to it would make them eligible for the DROP, which is the Deferred Retirement Option Program or Option Plan for deputy sheriffs and uniformed corrections officers. And I can explain the DROP if you'd like. It's a provision where an employee enters the drop when they're eligible for full retirement. They're then continue to work for up to 3 years, and during that time period, their pension is paid into an account for them. And when they leave after 3 years or before, if they would like to, they then receive their pension plus the money that's sitting in the drop account. So essentially, they get paid. They start collecting their pension before they leave, essentially, and that's how it works. It's been started with police and fire. Several years ago, the county approved it for sheriffs and deputy sheriffs and corrections officers. This would move 30 people who are not uniformed corrections officers, but who work in the Department of Corrections into that program. That's the bill.
Okay. Thank you, Mr. Drummer. This is the one that was previously bargained, I believe, and we were supposed to get it back in April.
Well, yeah, it was bargained in actually in 2020, and the council rejected it. It should have come over on April 1st, along with this collective bargaining agreement. If the executive wanted the council to approve it, it did not. It's late, and there you go. It's late.
There you go. Okay, public hearing. Thank you, Mr. Drummer. The public hearing is scheduled for September 14th, 2021 at 1:30 p.m. That bill is introduced. Now we have the call of bills for final reading. Bill 2021, swimming pools lifeguard requirement amendments. Let me recognize Council Member Katz and then Council Vice President Albornoz, if you have anything.
Thank you very much.
Yeah, I'll turn it over to Councilmember Katz and Councilmember Rice. But just thank you very much, Mr. President. I appreciate both colleagues' due diligence and thoughtful approach in the introduction of this bill, and sought clearly a lot of guidance and advice before its introduction, because it was a fairly straightforward conversation before the committee. There were a couple of amendments that we added. I'll just highlight one, which is that the language be made available in multiple languages to ensure public safety, and acknowledge the fact that so many of our county residents speak English as a second language. But and I also just want to note, as the former director of the Recreation Department, who, as I know, I'm sure all of my colleagues cares very much about water safety, that this is very limited in its scope. It's focused exclusively on a very small percentage of pools here in the county, and is consistent with practices and policies across the country. And this is the swim areas, which are small, are specifically for swimmers over the age of 16. But I will turn it over to Council Members Katz and Rice, who led this effort with unanimous support from the committee.
Thank you very much, Mr. Vice President, and thank you to the HHS Committee, and thank you to Councilmember Rice and his staff for their partnership on this, and of course, Ms. McCartney-Green for her thorough research and guidance. This is going to, as the Council Vice President mentioned, this is going to maintain the safety of our residents. It brings us in alignment with the county, with the state statute and our jurisdictional neighbors. We had many discussions on it, and we appreciate the community's input on issues relating to accessibility, sanitation, and staffing, and we also appreciate the additional amendment as well that would be in multi-language. So with that, thank you very much. I'll turn it back to you. Oh, I guess I'll turn it over to Councilmember Rice.
No, well, actually, Councilmember, you said it great. There's nothing really to add beyond the fact that I just really appreciate the due diligence of council staff really in being able to work on this and delineate some of the small amendments that we needed to make. So Ms. McCartney-Green, thank you so much for your help and support. And then to you, Mr. Chair, for continuing to, again, lead with safety, but also understand that from a practical measure, this makes sense in us moving forward from an economic standpoint, as well as a safety one. So thank you.
If I could, Mr. President, I'll mention that Mary Geis from presently in my office did a lot of the heavy lifting on this, and we wanted to publicly thank her as well. Thank you.
Thank you, Mary. Okay, all those, Madam Clerk, could you call the roll, please?
Mr. Glass.
Yes.
Mr. Glass votes yes. Mr. Tawando.
Yes.
Mr. Tawando votes yes. Mr. Reamer. Mr. Reamer votes yes. Mr. Katz.
Yes, I was watching Mr. Reamer. Yes, thank you.
Couldn't get there fast enough. Sorry.
Mr. Katz votes yes. Mr. Varro is not present. Mr. Rice.
Yes.
Mr. Rice votes yes. Mr. Friedson.
Yes.
Mr. Friedson votes yes. Mr. Albornoz.
Yes.
Mr. Albornoz votes yes. Mr. Hucker.
Yes.
Mr. Hucker votes yes.
Thank you. So that bill passes. And then next is Bill 321, Special Taxing Area Law, Silver Spring Business Improvement District established. Let me call on Fed Chair Reamer.
Thank you, Council President Hucker. I gotta say, I'm digging deep here. I feel like I'm on the last mile of a marathon day. I'm sure each of you may feel the same. 95-degree weather doesn't help. Okay, so I want to thank the Council President for co-leading this important legislation with me and the Joint Committee for a very careful deliberation and the consideration of a lot of different community feedback, a lot of community feedback in a way that I think is, there's a nuanced understanding of the Silver Spring community and the Silver Spring business environment that really is important that we have. And, our work as council members here, I know everyone is really familiar with the politics and the history of Silver Spring revitalization and the various attitudes of the business communities there, small business, large business, and so forth. And so it could be a challenging environment to try to make a significant change in. And what we're contemplating today is a significant change. I think the basic idea here is the county has for many years funded the same kind of work that often you see bids performing. You're all familiar with the various bids that operate in DC, DuPont, Georgetown, the Golden Triangle, Anacostia, they're all over DC. And typically what the government would do is allow the property owners to come together to form an association and then to levy a tax upon themselves. And if you think about that approach, it makes absolute sense that a board structure would be created where, a majority of the people paying taxes, it has to be, you have to have a majority of the people paying the taxes in order to make a decision. Who would want to join into an association where the people who are paying the most expense don't have greater control? It makes sense when you think about it, because it's a voluntary association. Well, it's not a voluntary association, but you're forming it that way. So that's the kind of nature of bids. Well, in Silver Spring, we've done things differently. We've had a government established and run association or program. And a lot of us feel like Silver Spring has outgrown that approach. And that's the basic idea, is that Silver Spring has achieved great success. It's dynamic, it's vibrant, it's diverse, it's fun. There's a lot going on. But it is now bigger than what a regional center staff can manage with marketing. And so our business community there, much of the business community there is asking if they could do that work instead. Could they take on the marketing function? Could they take on the clean and safe work and clean, safe, and welcome work? So we've given that careful thought, and Council President and I concluded that we did not believe it was necessary or helpful for the county to stop doing the clean and safe work, the red shirt work, but that we did think it made sense for
private sector leadership, which is already spending substantially to market the area, to take that function on. And so in order to not allow that, we would create a bid and then devote some share of the taxes that are presently going to the urban district to the bid instead, and then let the private sector do that work. There has been some controversies, no doubt. The initial boundary that was proposed for the bid did not match the boundary of Silver Spring, and it left out a couple of blocks that are predominantly where the businesses are predominantly owned by people of color or operated by people of color. And that created a sense that this bid didn't intend to serve the whole community. That's inappropriate. It's, that's a non-starter for us. And so we insisted that the boundary of the bid cover the whole community. We also heard a lot from the businesses in what we call Fenton Village, that they're concerned that the bid won't be responsive to their needs. And I think generally we feel like those very small businesses need a little bit more. What they need to succeed is more than what a bid might be able to provide. They need something more like the kind of impact assistance that we've provided for the Purple Line or for the Wheaton, redevelopment, like technical support and even sometimes small grants. So we talked about something called a Main Street Partnership. And Tacoma Park has the only Main Street in Montgomery County, but Main Streets are springing up all over the country and often as companions to bids. So you have a bid and a Main Street providing different services. The Main Street's typically providing really detailed hand-holding services to very small business. And so Councilmember Navarro and I have discussed our interest in reconvening the committee, the Joint Committee this fall, to continue the work we have started with the idea of Main Streets. And we think that there could be a Main Street for Silver Spring and for the Fenton Village area, one for Wheaton, maybe one for Germantown. There's different parts of the county that might benefit from it. So that is a positive, development that's come out of this. It's not embedded in the legislation because it doesn't need to be, it doesn't really have a role. So the legislation that you have basically creates a bid, but restricts it to marketing. It does not have any role in the Clean, Safe, and Welcome program. That retains, that work stays with the county through the registered program. And it creates a board. The board is divided between small and large property owners, small and large business. And we will, at a future time, sit down and figure out the funding that would be devoted to it from the existing funding. And there's all that detailed work is ahead of us. This is simply allowing for the entity to be created and constraining its role to a certain role, and that we hope the bid will be successful and build a lot of community goodwill. And in a year or 2 years, we will have a very successful enterprise that the small business community, the consumers, the customers of Silver Spring, and the community generally feels like has been adding a lot of value. So that is the kind of, from a distance summary. Turn it back to you, the council president, as you may wish to add a lot to that, and then we can go to council staff for the legislative summary.
Sure. Thanks, Councilmember Reamer, for your leadership on this, and to you and Chair Navarro yesterday for the work session. That was very productive. You all know Silver Spring is very dear to my heart. I know it's very special to all of you. It's our home, and all of us want the best for Silver Spring, for my kids and your kids to continue to enjoy. And in my efforts to study Silver Spring over the last 20 years, it's certainly become a great place to live and work and play for individuals and families. And it deserves to be a lot better than it is, and to continue that growth. But unfortunately, in recent years, we've been really losing some of the gains we've made. And that happened during COVID. That also happened prior to COVID. I can tell you, as the local council member, my staff and I hear every single day about multiple challenges and continued problems that need to be addressed. Whether they're graffiti and street harassment, petty crimes, and many of the sort of nuisances that we experienced in the 90s before the redevelopment of Silver Spring. And it's really striking that we've had 20 years of job losses in a row since Discovery first moved there. There are fewer people on the street dining and shopping and listening to music and enjoying a movie and enjoying this fantastic community that has been created there. And unfortunately, many iconic businesses that have been around for decades that survived multiple recessions. Mrs. K's was around for about 80 or 90 years. Sergio's, Expectations, Pachi's, they're no longer with us. They were hurt by the pandemic, but many were struggling pre-COVID. We also, like many aging inside the Beltway communities, have aging infrastructure and are now 20 years past the redevelopment of Silver Spring and need not just more investment, but new strategies. The rising office vacancies, the continued loss of jobs year after year just suggest we have to do things differently. The main tool we've had for marketing and promotion and placemaking has been the urban district in addition to its clean and safe work. We all love the urban district and our red shirts, but they can't do everything that Silver Spring needs. And we're at a critical moment really in the comeback story of Silver Spring. Reputation takes a long time to build and it can be lost very, very quickly. Some of the gains of the past have been slipping away, and I think it's very important that we take some action to ensure that Silver Spring continues to improve to a level where it can compete with other jurisdictions in the region for jobs and for young people and for people to move to and begin to build on and realize their dreams. We've certainly learned the government's not very good at marketing and placemaking. We can and move forward with this bill with a partnership that includes our county professionals, but also unlocks the special professional skills of the private sector. I've reached the conclusion we need all hands on deck to address the challenges we see in Silver Spring and to make it as rich and diverse and prosperous and fun as it should be. I think this bill goes a long way toward doing that. We want to make Silver Spring a cooler and more desirable place to live, just like Capitol Hill, just like Arlington, Southwest DC, Alexandria. We're not keeping up with many of our competitor jurisdictions around the region. And I'm grateful to the Joint Committee for improving on the original proposal by, we know moving forward we can ensure even more diversity on the board by offering the board additional tenants from a list suggested by the council. They're happy to add them. Standing up the Main Street program to help a lot of our legacy businesses, as Councilmember Reamer mentioned, and continuing to work with our state legislators to improve on the state legislation that allowed the creation of bids by expanding the board and making other improvements like that. This is an iterative process. I don't think this is the end of the story. This is the beginning. And I'm confident that we can walk and chew gum at the same time. We can allow the private sector to brand and market Silver Spring and add programming while we protect and grow our long-standing businesses. That's very important to me. And without doing anything differently, they're very much at risk every day. We don't know who will be the next to go the way of Sergio's or Pachi's or Expectations or Mrs. K's, but we can't allow more job loss and more small business loss in Silver Spring. So grateful for all your work on this from the Joint Committee, and I will call on Councilmember Albornoz, Vice President Albornoz.
Thanks. I wasn't expecting to go first, but I'm happy to. So I guess just a few observations. I'll be candid that this was a very quick turnaround to go from committee to full council. And I know that this has been discussed comprehensively within our committee assignments. But I know that we're obviously about to go on recess for well over a month. And so that's a little unusual. But moving forward, I certainly would appreciate it if we had a little bit more time to be able to process and digest really important decisions like this. Having said that, I do acknowledge and appreciate the numerous amendments and adjustments that were made to the initial bill. Obviously, there are a lot of really important stakeholders here. And Mr. Council President, I think you said it well in that this really is an all hands on deck situation. Marketing clearly is an important component. It's something that we all have to take very seriously and is something that is important to raise all boats. But there are a number of issues in the public safety space, in the health and human service space, in addition to the economic development space that all go hand in hand that we're going to have to address holistically. And so I'd like to suggest, Mr. President, and I appreciate your leadership. I know your staff is incredibly engaged and attends as many meetings as they can, and that's most of them with regards to so many different issues. But downtown Silver Spring is critically important to the economic vibrancy of Montgomery County moving forward. And this is an important step forward because I think staying pat is not really an option. And I was disheartened to see that our business community is not entirely aligned on this issue, as I'm sure all of my colleagues are, because it is important that we stay as close together as we reasonably can. And I do appreciate the very sincere and thoughtful approach that Chairman Reamer noted in partnership with Councilmember Navarro to revisit those specific components and address those outlying very real and very understandable concerns by our smaller businesses, which do need a unique set of marketing and support that may be different than some of our other larger businesses and commercial office spaces. But I think we can do all of it. But I think that I also very much appreciate the thoughtful approach in ensuring that the on-ground customer service, which are the folks in those distinguished and beautiful red coats provide to the community, I'm glad to hear that will continue. And because I think that's a critically important too. Final two things I'll add for now is, prior to the pandemic, obviously special events are important. The Jazz Festival, the Thanksgiving Day Parade, the numerous events that go on within our concert series downtown. Obviously it's all connected and we need to be more intentional moving forward. But I also think we need to be even more intentional than we have been about infusing our arts and humanities. And I really do want to thank our lead on this in Chairman Rice and our Education and Culture Committee. But I think that will also need a higher degree of investment moving forward as part of this overall package. And so all that to say this, Mr. President, I'd like to suggest, I know we've actually had conversations about this. There's just been so many things going on, but perhaps in the fall we can have a full council session to more holistically look at the myriad of issues, in addition to economic development, that were specifically addressed with this legislation that cover those other aspects. So that, and perhaps, I know we just approved the OLO, reports that are, I'm running out of gas too, Councilmember Reamer, but that we, for this upcoming year, but I do think that this is an all hands on deck situation. And I think we have to look, because they're all connected, and it's important for us to look at this holistically. So I am going to support this measure. I wish I'd had more time to process and digest it, but I do appreciate the efforts that went into the development of what we're going to vote on today.
Thank you. Councilmember Glass. I'm sorry, Councilmember Jawanda was next. Beg your pardon.
Thank you. This was I appreciate you mentioning the quick turnaround, Mr. Albanese. I had made two requests. First, that we just take some time so everyone can process this and deal with it when we get back. That didn't happen, but then I also made an alternative suggestion, and we discussed it at length yesterday in the joint committee, because we all agree that we need to improve upon the great place that is downtown Silver Spring. And I've said this before, but I'll say it again for the millions watching at home, Councilmember Rice. I dare say anyone on this council, I've spent almost all 40 years of my life in 20910. My mom worked there, my dad worked there. I ate at Tasty Diner where Discovery is, the Blue Plate Special. I did my homework there. I walked from Oakview down Wayne Avenue and took the bus there. I got a tattoo and had dates, and everything has happened in that central business district for me. And so I speak, I think, with a good sense of what downtown Silver Spring was, and can be. I also got an autograph from Dikembe Mutombo in the grill one day. He used to go there for games when he played. So that was a really cool moment. I love it. And I know we all have those memories, because I think it's so representative of what is the best of Montgomery County, our 4 most diverse cities in the country, Silver Spring being one of them. When you're in downtown Silver Spring for the Jazz Fest or just an evening going to the movies or walking around, it's what you want America to be. And it's that because of the business community and the residents and the property owners and everything. It's because of everything that it is. And we need an all hands on deck approach. But unfortunately, this is not that. This is a small group of concentrated people that will have the voting power and decision-making power to spend taxpayer dollars to market and promote the way they see fit. That's what it is. And the small business owners, the Black and brown business owners, and they're not all small, by the way. One of the owners of probably the most revenue-generating businesses in downtown Silver Spring, who's opening 2 other businesses in the same central business district, is opposed to this. They are not involved in this process and are not able to vote because of the way this is set up. And so acknowledging that we can do things better, can we market, can we improve things? We've got a new redshirt director, Carson Henry from YMCA, who's been going to do a great job. Absolutely. So I propose an alternative to create an urban district corporation, similar to what's done in Bethesda and other places, that would have given that corporation, that board, which we could set, would be diverse. It would have property owners, it would have residents, it would have small business owners, and they would all have votes and a say, a democratic say, in how this area is promoted and marketed. And we can do it with existing authority. We wouldn't need to pass this bill. And it was supported by the Fenton Village folks, it was supported by the county executive. It was not supported by the joint committee because, they moved forward with the bill. But this is not the way to do it. You don't build an all hands on deck approach with half the deck not on board. And they are not on board. And not only not on board in a big way. And I just think we're making a big mistake. And the last point I want to make, we all care about racial equity and social justice. The Racial Equity and Social Justice report on this bill says, and I quote, "The concentration of voting power for board members with the largest assets shifts the power of public district decision-making from a stakeholder group representing diverse cultural and income backgrounds to a stakeholder group that predominantly represents the interests of medium and large businesses. Granting greater voting power to board members with larger businesses also shifts decision-making power from people of color-owned businesses to white-owned businesses, as the latter on average are larger than the former." It's one of many striking and clear lines in the racial equity statement on this bill that this will have a negative impact on racial equity. And if we want Annapolis to fix the bill, I've talked to our delegates, I've talked to the District 20 delegation, each one of them, who was asked to pass this bill in this exact way, by the way, with the restrictions on voting. And in talking to the proponents of this bill, it's important to them that the property owners remain in charge of the voting and decision making, which is not democratic. We should do that before we pass a bid, or we should do the alternative proposal that I made, which allows us to do something different and have the private sector involved with marketing and promotions, if that's the goal, in an inclusive way. But to say that, oh, well, the state legislature did what we asked them and we don't like it now, that's not a good enough excuse. They are actually in favor of us not doing this and moving forward. So there's no urgency. We can move forward with another plan with the Urban District Corporation. We can let them pass the bill later on. But if we lock this in place and this bid moves forward without the community support, it's going to further divide the community and it's not going to be representative. And I think we're making a big mistake if we move forward in this way with this bill. So with that, I will not be supporting it. I would encourage colleagues to consider the statements I've made in the alternative proposal. We don't have to rush on this. We don't have to rush on it. Thank you.
Thank you, Councilmember Glass.
Thank you, Mr. President. So I moved to downtown Silver Spring by way of Bethesda nearly 20 years ago. And as has been noted, it was a little different back then. And it was a little different when Councilmember Jawando was being raised there a few decades prior. But when I moved there 20 years ago, I moved down to the East-West Highway area as the first real master plan started becoming a reality, and buildings started being built, and new apartment buildings and new condos. And so when I moved down East-West Highway and I was walking to the metro, I needed to figure out how to fix sidewalks, because my new neighbors and I were having a difficult time not only walking on the sidewalk, but crossing the street, East-West Highway, just to get to the metro. And it was through those conversations with some of my neighbors that we formed the South Silver Spring Neighborhood Association. And I formed that and became the first president of it alongside my dear friend and friend to many of us, David Fogel, an incredible activist and small business entrepreneur. And we, the community, built street festivals, rather large street festivals with music and vendors and restaurants. And we did the organizing and we did the marketing, most of which was guerrilla marketing. It was a lot of fun to do, but ultimately it was placemaking for residents by residents. And I share that as background because so many of us and so many in the community have been working to make Silver Spring an even more thriving downtown area for decades. And we all care so much about that community and want it to succeed. And we need it to succeed for Montgomery County's future and viability within the region. And when I talk with residents and business owners, nearly everyone agrees that more needs to be done to promote parts of the Central Business District. Nearly everyone agrees that we can do better. And ultimately, that's what we're talking about right now. And I think that was the inception for this piece of legislation. Thinking differently so that Silver Spring can be an even better place to live, work, and play. And so I appreciate the sponsors of the legislation for starting this conversation, because there hasn't been much change in the way that we activate and portray downtown Silver Spring. But it's important to note that when this legislation was first introduced, I did not co-sponsor it. And the reason I didn't co-sponsor it is because I had questions about the board makeup. I had questions about the allocation of resources. And I had questions about the employees of the urban districts, the red shirts. And so as the committee conversations moved forward and I was able to speak with sponsors and was able to speak with supporters of this legislation, I learned that the board composition was dictated by state law. And in an effort to assuage my concerns about the allocation of resources, I, along with the sponsors of the legislation, wrote a memo supporting a Main Street partnership, particularly in the Fenton Village community, so that we know that dedicated funding can go to those small businesses in that geographic area. And I want to make sure that our small businesses are able to thrive and prosper under this plan, all of our businesses, making sure that they thrive and prosper. And the only reason I was able to come on board was because of that commitment for the Main Street partnership. And I'm glad to see that there's even more interest here in the county, in the council, and look forward to those continued conversations in the fall to figure out how we can make that a reality here in Silver Spring, in this particular area, but also apply it to other parts of the county where we know it's necessary. And throughout this public policy conversation, I've had some candid and quite frankly emotional conversations with some of our small business owners. And these are entrepreneurs who have started their own business with their own sweat equity, and in many cases have traveled the world to make Silver Spring their home and to start their business. They are invested in this community. And that is why it is so important for us to continue our investment in them. And when the bid gets off the ground, as I presume it will be with the vote that we'll have in a few minutes, if we see that resources are not being distributed equitably, we can change the legislation. We can work with our state delegation to change the enabling legislation and then also change our legislation. If this needs to be improved, we can and will fix it. I promise that, at least from my perspective, to all the small business owners and to the residents who have expressed concerns to me. But all of this comes on the back of recognizing that we do need to think differently, that change is possible and change is needed in the new Silver Spring that is here. And so for all of those reasons, I am going to support this legislation, but I'm also going to commit my support to fixing the legislation should it need so in the future. And so I appreciate this conversation. I appreciate the sponsors, and I most importantly appreciate our shared commitment to the Main Street Partnership Program, not only to make sure that the small businesses in Fenton Village are able to participate in it, but also see where else throughout Montgomery County we can have some more efforts for the small businesses and get them more resources that they need and deserve. Thank you, Mr. President.
Thank you. Councilmember Rice.
Thank you very much, Mr. President. And so, this isn't an easy one. So I have to associate myself with the comments that Vice President Albornoz made at the beginning, because it's hard, being that we had so many other big lifts that we were doing, to fully digest everything that's associated with this very complicated process. But I do want to thank both the GO committee and the Fed committee for their great work. And I want to thank staff for doing a great job of kind of putting everything together into the packet that gives us the ability, those who aren't on those joint committees, to understand. And I really want to thank Councilmember Jawando for reaching out to me and discussing some of his concerns as well. It's not easy because I certainly see and understand where his concerns are from an equitable standpoint. But I also understand that we're stuck with the limitations that we have in terms of membership from the state at being 9. I would love to see the balance be a little bit different so that you could have some small businesses that, every time we describe Silver Spring, we always talk about how small businesses are the lifeblood of Silver Spring. I'm similar to Councilmember Jawando, born and raised in Silver Spring, 20906. So one of the other zip codes, but still there. Everybody knows I went to Tacoma Park and went to Blair. And so, I grew up there and spent all of my young years there at City Place and going to, while you were at the diner, Councilmember Jawando, I was at Bob's Big Boy over right at Wheaton, right? So, I'm dating myself. It's all good. But yeah, no, so look, this is home, right? And so we want to do the right thing. And it's hard.
I miss Hot Shops on the corner of
yes. There it is. That's it. We can reminisce all day about this. It's great stuff. But no, I've seen great businesses that used to be there that struggled. I spent a lot of my time in the Silver Spring and Wheaton areas, and it really is one in which, for me, I want to see Silver Spring advance. I want to see the opportunities. I continue to look at City Place as a tremendous opportunity for us, just like I look at Lake Forest Mall as a great opportunity for us that's been just sitting there nascent for so long and hasn't been able to really achieve all that it could, while other things around it have come along. And how do we continue to make that happen and spearhead those efforts? Well, we've got to do something different. We can't keep doing things the way we have been. And so I think everybody's in agreement there. It's just about achieving that balance, right? That balanced voice that makes sure that folks can hear from individuals who are in the community, who are invested in the community, who've put their blood, sweat, and tears into the community as a business owner, and make things happen. And so as the husband of a small business owner in Bethesda, I have to say that I do understand the ideology around the, different sorts of approaches and what some of the benefits and drawbacks may be. But I will say this. I do think that with the amendments that were proposed, it makes it better. So I'm in the same category as Councilmember Glass, to where it's like, it gets better. It's not good in my perspective, but it's okay, and it's still going to require a lot of work for us to have to do to push it across the finish line. So from that perspective, it's like, and I hate to describe it like this because I don't want to disrespect the folks who have done great work in achieving the bid process and setting everything up. I mean, but it's one of those where I'm just kind of like, at this point, but we need to do something. And so, you know, for the sake of moving something forward that is going to help to make sure that we can take Silver Spring to the next level, but we're going to have to do a lot of work. And so this is where the, you know, community is going to have to hold the council's feet to the fire. County government is going to have to play an integral role in terms of making this work based on the structure that we have before us. It is not just going to be able to thrive on its own. It's going to require a tremendous amount of work. I won't be on this council. And so I'll be rolling off. So it will be up to, you know, 5 new members of the council, as well as those who return. And so from that perspective, I would just say to those who are still here, remember this day, remember your commitment, remember your conversation that you had in terms of making sure that these small businesses would be represented, that their voices would be lifted up and heard. That's incredibly important. And so there has to be a promise that that's going to be a part of this. I agree with Councilmember Glass in terms of the Fenton Village piece. All of that encompassed together is okay. And so, you know, I wish we had more time, like Councilmember Alberno said, so that we could even think of some more innovative ways in which we could possibly do this. And so, you know, I would certainly be supportive of, you know, taking another month or two to analyze this and see if there's anything else we can do. But at the same time, I also understand that we can still make changes, right? That's the beautiful thing about government. We can always vote to change things anytime we want to. We're not limited. So from that perspective, you know, if we do come up with some other things, and I encourage folks to continue to have conversations with me. I appreciate the folks who have reached out and talked to me and expressed their concerns. Those are incredibly valid and made it very hard. But I do think that, you know, we'll move forward, but continue to have this commitment of having this open dialogue and conversation about ways we can continue to try and make sure that this process is working for everyone, especially those small businesses that are out there that, again, may feel marginalized as a result, and how we can continue to lift them up and make sure that their voices are heard and impacted as a part of this process.
Thank you. Just a couple quick responses to some issues or questions that were raised. One, on the timing, yeah, I mean, I asked both committee chairs if they wanted to vote today, and both said they did. So I'm just trying to accommodate that. There's plenty of opportunities to talk about this in the future as well. I like Council Vice President Albornoz's idea of having a deeper dive to go into implementation in the fall. And where we can consider all aspects of this, including the new leadership of the urban district. And I really think there's a room for more oversight of that. I personally asked for the budget and detailed line item budget of the urban district for years and had a hard time getting it. And I really think they would benefit, and all of Silver Spring would benefit from more oversight. We've really never had any oversight of their expenditures or of those board members. I definitely want to have council eyes on and oversight of the bids staffing plan and branding and marketing plans. I think we all ought to be involved in that moving forward as well, to make sure that it includes all voices and that we're comfortable with the types of events and the types of messages that are out there, and that it protects and serves especially our longest serving small businesses that have put so much, greatest amount of equity in the community. Anyway, those are my issues. Councilmember Reamer, Council Chair Reamer.
Thank you. Just want to add to that, to reiterate that what this legislation does is allow for the bid to form. It does not send any funding to the bid. So we've got some major conversations ahead, at which point I think it will be necessary for our private sector partners here to come to the table in a way that, is addressing these concerns. So, we've got a lot of work ahead of us, unfortunately. But I think the community concerns need to be heard, and they need to be, responded to. So we'll take that up specifically what the budget is, what the tax rate is that's assigned. We'll take that up in the coming months. Ultimately the action would be in the budget this next year, I believe, is really how it will be done. So there's time to work on that, and then also we'll develop this idea of the main streets, and then try to position that for the next budget. So the next budget might have some significant action to take this to the next level. But without this step, you can't do the second step. So plenty of work ahead and opportunity for concerns to be addressed.
Councilmember Jawadu.
Thank you. This will be my last point. I know it's been a long day, but we're getting ready. This is important. We're building on a really shaky foundation. And I know we all want to build something. We all want Silver Spring to be well. You can't do it where you have so many people that are really upset, and legacy business owners that we would all name as the core of Silver Spring are not on board with it. You just can't do it this way. And so they're going to go, Mr. Silverman on behalf of the clients has said, we've been working for 3 months to get people to join our board, and not so that they can be there and not vote in the capacity to get businesses of color and small. They've all refused. You know why they refused? Because they know they don't want to be tokenized and not really be a partner in it. And we pass this, they're going to put their board together. They're going to still do outreach. They're going to come back and say, 3 months we've been trying, no one has joined. And here's our plan, and here's what we want the tax district to be. And then we're going to be in the same situation with more divisiveness. And I would just really caution us to it's not going to move the ball forward to pass this today. All it's going to do is create more problems. And there's other paths we can go to have a different approach. It's not like it's an all or nothing thing here. So I understand the desire to do something, and I share it. And I've tried to be constructive in proposing different models and approaches. But I just really think that this is not going to work out well, because the governance structure, a core issue, it's going back to the drawing board and us sending them a list of names. I wouldn't know any names to send them. I've talked to dozens of businesses. I can't send them any names because the people won't do it. And so I just think we have to remember that. So, all right. Thank you, Mr. President.
Okay. Anyone else? Councilmember Rice.
Can I just ask a question? So in terms of process, if this passes today, because I want to understand, because Councilmember Reamer, you said something, Chair Reamer, and so I just want to make sure I understand it. This allows for them to start filing certification with the state, correct, in terms of creating the bid, but they still need funding to be able to operate. So the operation of the bid still can't happen until the council comes back. At which time, if the council had other information about restructuring, I'm not saying that we would, I'm just saying, if the council came back and said we had more information about we wanted to restructure a different kind of way, we could do that before we enacted funding. That's still possible. I'm just asking.
Anything is possible, of course. We should ask Bob what the next steps would be, but
with state law,
legislative changes would require legislation. Operational changes can be achieved through our next step, which will be operational, if I'm understanding it correctly.
I just want to maybe just go back one step. Under the state law, 51% of the non-exempt, essentially commercial properties in the district, 51% of the properties and 51% of the assessed, representing at least 51% of the total assessed value of the commercial properties in the district, have to apply for the bid. So in essence, it's voluntary on the businesses in the district, and you have to get more than half of them on board, both by assessed value and by numbers. So if the state legislature, which wouldn't obviously happen until the earliest next July, probably next October, changed the the makeup of the board, allowed the board, the people to, it's really not the makeup of the board, it's the people who vote for the board of directors. They have to be members, owners of non-exempt property who are actually paying the tax, the bid tax. So if you changed it to an urban district type, of who gets the vote, you may not get 51% of the businesses to actually ask for the bid. If you know what I mean. I mean, it's voluntary. The businesses need to start this. Yeah. And so it's like a difficult, chicken or egg kind of situation. So I don't know that you can assume that the state legislature would change the law and then the bid would just change.
Right.
It's not from here on now. What is true, though, is the council retains significant control over the operation of the bid through two methods. One is you have to issue the tax rate that supports them. And every 3 years, they have to be recertified.
Right.
So at any time that the council's not happy with what they're doing, you can cut off their money and you can pull the plug on it.
Yes.
So you do have a lot of control over it.
Thank you, Bob. That's what I wanted to say in response to Councilmember Rice's question is, I have certainly talked to, there are people who have concerns or have not had, less pleasant experiences with bids in other parts of the country because many bids, if not most bids, don't have this level of public sector control. We have enormous control over this bid because we set the bid tax. We have to approve it. And so regardless of who's on the board, they're going to have to follow the council's direction and our commitment to racial equity and our commitment to our small businesses, because otherwise they're not going to get their money. That's just how this place works. And I think that's been a little understood fact about the structure of this bill, not other bids and other places, this bill and this bid. And without that, I wouldn't be comfortable with it.
Could I just say that's like to your question, Councilman Rice, that is true. That's kind of a nuclear option, right? Like, we all want something to happen, marketing, promotion. If we cut the money, and you're not doing what you're supposed to do, so we're going to take your money away. And who's doing the marketing and promotions? I mean, I get that sounds nice, but it's not going to work that way. It's just not. We're not, we've been talking about WorkSource Montgomery in that vein for 4 years since I've been on the council. We never cut their money. And so I think I understand that. I think the better way to do it is to build a coalition from the beginning. I would like to move to table this bill.
Is there a second? Okay, dies for lack of a second. Okay, any other comments from colleagues? Oh, okay. Madam Clerk, I believe Councilmember Reamer.
Just one last comment. Again, we will have lots of opportunity to continue building this the way we'd like it to be. I really believe we've got to work with the private sector. And the private sector is asking to do this. And I think it's going to be beneficial. I think people are going to get on board. Maybe not 100%, but I think people are going to get on board as we proceed. So I'm optimistic here, but I always have heard the concerns. Thanks.
Right. But it's up to this group how we exercise our oversight. We have the authority under the law, the bill. Okay, Council, I think that's everybody. Okay, Madam Clerk, we have a recommendation in front of us from the Joint GO and Fed Committee for this bill as amended. Could you please call the roll?
Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Tawando?
No.
Mr. Tawando votes no. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Ms. Navarro is not present. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes.
All right, everybody, that bill passes. I believe that's the last item on our agenda. I hope everybody has a very safe and enjoyable and restful few weeks, and we are now adjourned.
Those with respiratory problems should limit their outdoor activities. Please use public transportation to help reduce ground level ozone.